by Rotary International District 9112. Welcome everyone, and thanks for your patience. It's going to be a very exciting morning. We have a fantastic lineup of speakers, experts, professionals, and those who have experience personally in this field. So it's exciting to get you on board. I would like to, without further ado, introduce you to a very important individual. In fact, he is the chairman of my GYNAE Issues Foundation, Professor Rotimi Gynaecological. And please, just before, because I know we want to clap, let's just talk about his profile a bit. So he's a 1978 graduate of the University of Ibadan, and he was appointed consultant in obstetrics and gynecology in the UK in 1994, the first Nigerian to be appointed. Professor Gynaecological is currently the Associate Medical Director for Patient Safety at Basildon University Hospital, Essex, and visiting professor at the Faculty of Law, University of Ibadan. He is a UK National Health Service Patient Safety Specialist, a Senior Fellow of the Faculty of Medical Leadership and Management, and a Fellow of the Institute of Information Management. He's a Fellow of the West African College of Surgeons and Fellow Royal College of Obstetricians and Gynecologists. He also holds a master's degree in business administration from Newcastle Business School and a master's degree in medical law from Northumbria University, Newcastle. Professor Gynaecological is a transformation agent with a vast wealth of experience in clinical care, health policy, and global health development. He co-authored Nigeria's national policy on gender and health, and contributed to the Nigeria's national policy on diaspora matters. He has published over 60 scientific articles and presented at numerous international scientific conferences. He is currently the chairman of the advisory board of the Nigerian Commission of the Global Eradication Program for Hepatitis and a member of the Diaspora Professional Plus Healthcare Initiative to reverse Nigeria's brain drain. As chief executive, Trojan Medical Group, he is currently undertaking healthcare infrastructure development projects in Nigeria and offering telemedicine health services. So please, let's give a worthy round of applause to Professor Gynaecological as he comes and speaks to us on the topic of maternal, on the topic, okay. Hello, sir.
Yes, I am. Yeah. Good morning. Standing on existing protocol. Can you hear me?
Yes.
Lovely, thank you. Just to give my thanks, appreciation to the Rotary Club for creating this platform to collaborate with you for the Gynecology Health Summit. I was delighted to hear Rotarian Adedoyin when he said, I think he said that without mothers or without women, really what I would say is without women, life will not exist. Society will not exist. So it is very important that as a nation and as a society, that we ensure that we care for our women. And caring for our women doesn't begin when they become women. It starts from when a baby is born, a female child is born. All the iniquities that exist in terms of education, health, access to health, shouldn't be, because the disparity does affect the health of women. So we will be advocating that a girl child is equally as important as a boy child. There shouldn't be any difference. So as a society, we must accord our girls, our children, female children, all what they need to grow and develop, because they are the future of our society. And we also have to be mindful or knowledgeable about the economic benefits that women bring to society, whether they are housewives staying at home, looking after the children, it has its own economic benefits as well, or whether they are chief executive of boards, it has its own benefits. And really talking about gynecological health, it does start from infancy right till the end of life. That span is very important, where women are exposed to many conditions such as endometriosis, fibroids, heavy bleeding, painful periods that men as in men, do not appreciate or go through. Not to talk of pregnancy, carrying a baby for 9 months, breastfeeding, looking after children. So there is a lot to talk about today. So I'm going to keep it very brief as we speak. So this is just to say, welcome once again to my Gynae Issues Foundation Gynecology Health Summit 2026 in collaboration with Rotary Club 9112. Thank you, and we look forward to a very inspiring and thoughtful discussion. So thank you.
Okay, Professor. Professor, it's a pleasure to meet you once again, everyone. My name is Israel. And we'll go back to Professor. Once upon a time, in a very special country, the girl child was looked at as not quite second citizen. It was a world where men were at the forefront of events until the awareness came and the girl child was celebrated. But let's take this scenario. The girl child decides to study, gets into university, gets a degree, starts working, gets married, which we all love. And she wants to start a family. Well, guess what? There's no manual to tell you how to start a family. There's no manual to tell you how to take care of your body. There's no manual to tell you how to raise a baby. Now she's pregnant. She wants to have a baby. But how will she take care of her health? What will she do? What are the challenges? Amina is in the village, and she likes to work. She goes to the farm, and as tradition will have it, she has to get married at a certain age. She stops her farming to be given to a man in marriage. She's not aware of what it entails. She's happily married, but now she's pregnant. What will she do? How will she take care of herself? Who will educate her? Meanwhile, she's at the village. No exposure to health centers. What will Amina do? These are the questions that the girl child has to go through. And that's why we're here today, to empower her, give her the necessary knowledge so that she will not be part of the statistics. We know that in Nigeria, the mortality rate is really alarming. Out of every 1,000 or 100,000 that give birth, over 1,000 die at childbirth. 1,000 women. That is a total loss to a nation. So we must stop it. And how can we stop it? When we come to have such programs here at the GYNAE program, we educate people on how they can take the next step in transforming lives and saving that woman. We know that when a woman is affected, the family is affected. So today, we'll be taking you on that journey to empower women to stay alive after obeying the natural course of nature. Welcome again to this wonderful program. Without further ado, we will be asking Professor Jaisimi to take us on the topic, Importance of early prenatal care. Essential screening every pregnant woman. Essential screening for every pregnant woman. And the preventive causes of complication. Professor, please, could you take us on the importance of early prenatal care? Thank you very much. Put your hands together for Professor.
Yeah, thank you for, again, that kind introduction. Talking about pregnancy, people consider pregnancy to be a normal process, but as we've heard this morning, 1,000 in 100,000 women die during childbirth, which is very bad. Women should not die while trying to bring life, new life into the world. That is not something we want to happen. And that's very common in Nigeria and in low to medium income countries. Whereas in the Western world, the figures are not as abysmal as what we have in Africa. And that is why we want to address these issues. Now, it is important that women, before starting a pregnancy, are in good health. And when I say in good health, you want to be in optimum health, ensuring that your blood levels are normal, that is, your blood count, you're not anemic due to either malaria or worm infestation or poor dietary means. So you have to optimize your health before embarking on a pregnancy, and that's prenatal care. And apart from the nutritional aspect of prenatal care, one of the aspects that we also advocate is how do we prevent neural tube defects? Neural tube defects are conditions that can affect the spine where there is a defect in the baby's spine, and that can affect the baby in terms of bladder function or function of the limbs, or even development of the brain. So women are advised that before you embark on a pregnancy, once you start contemplating that you want to have a baby, that you should start taking folic acid, which you take until about 13 weeks of pregnancy. That reduces the risk of developing neural tube defects. In addition to that, I would also recommend that because of the prevalence of anemia in our society, that taking multivites, perhaps the ones specifically manufactured for pregnancy, women should also take that. That will ensure that their blood level, their hemoglobin, is optimum before pregnancy starts. Because in pregnancy, as pregnancy advances and as changes occur in the woman's body, there's going to be a dilution and a reduction in the blood count of women. So anti or prenatal care in preparation for a pregnancy is also very, very important. Another aspect that I will make a little bit of reference to is knowing your genotype. That is, are you hemoglobin AA or AS, SC or S or AS? This is important because, again, people do not want to bring into the world children who will suffer from sickle cell disease. Well, it's not an absolute necessity, but it is advisable that before you get married, you know your hemoglobin, your genotype status, and the genotype status of your potential husband. And again, I don't want to dwell into that because that's ethical. There are ethical aspects to that. There are religious aspects to that. But it's just to bring it to the fore that it's good, apart from the marital and having children aspect, if a lady is SS, they will be anemic, and it has potentially serious problems during pregnancy. So it is important that you know what your genotype is before you start a pregnancy. Now, when a lady falls pregnant, it is important that we know exactly when the pregnancy started. That is, in terms of dating the pregnancy. I think things are better now with the presence of multiple apps that you have on your phone that you can track and monitor your menstrual period. Many, many years ago in the 80s or even in the 70s, when women, at least in Ibadan, I can speak of that, were asked about their last menstrual period, they will say, "Oh, let me ask my husband." But I think we've moved far away from there, where women have to depend on their husbands as to when their last menstrual period is. Now, the importance of knowing your last menstrual period, as well as how long your cycle is that it helps us date the pregnancy. But that's a subjective aspect because, like I said, most women perhaps do not know when their last menstrual period was. And what we now have is an ultrasound examination done at about 8 weeks to 12 weeks that accurately dates the pregnancy. So we can tell how old or the gestational age of the baby. And in doing so, we ensure that the baby does not grow past 42 weeks. Because if that occurs after 42 weeks, the chances that that baby might die is important. So it's very important that you book for antenatal care in a good health facility. One of the things I was told, I was in Nigeria not too long ago, I was told women will go and book in a reputable hospital, either government, either teaching hospital. But after they have been told that all is fine, your baby's okay, you don't see them come for their delivery in hospitals. They go to faith-based centers or traditional birth attendants, where when things go wrong, there's no help. So it's important that antenatal care takes place in health facilities where you have trained personnel that will help you through the journey of pregnancy. Now, when it comes to the screening test that are done varies from country to country. Uh, for example, in Nigeria, I would say full blood count is done to ensure that you're not anemic. And if you are, then they commence you on iron tablets or folic acid or vitamin B12. We've spoken about your genotype, why it's important. Then there's the resource factor, which is a form of blood group. You've got the positive, you've got the negative. Now, if a woman, Shobola Abimbola, please. Shobola Abimbola, please. Can you mute yourself? Okay, I'll continue. But can somebody ask Shobola Abimbola to mute him or herself? Shobola Abimbola, can you mute yourself, please? Lord, thank you. Yeah. Yes, I think I got to the stage of talking about the resource factor. Now, if a woman is resource negative, and the husband is resource positive, there is a possibility that the baby during pregnancy is resource positive. The mother recognizes that the resource positive factor is different from hers being resource negative. And during pregnancy, if there's bleeding, part of the baby's resource factor cells, negative cells, can go into the mother. And this can cause what we call resource isoimmunization. This will not affect the first baby, but subsequent babies may be affected if they are resource positive. So it's very important that you know your genotype as well as your resource factor. Now, blood group is also important. It's part of the screening test we do just to make sure that if you need blood, it can be obtained as soon as possible. So we want to know your blood group. That's part of the test we do. And we also do now know that HIV infection is very common in Africa and in Nigeria. And in most centers, ideally, women should have hepatitis B screening, HIV screening, and this helps in managing the mother as well as in preventing transmission to the baby. So resource factor, HIV, hepatitis, and in some countries, again, a number of viral infection screening is done. Now, because of pregnancy, things do slow down in the body. Women have constipation, they are prone to having water infection. And because of that, at every contact that a woman, a pregnant woman, has with a midwife or a doctor, it is important that we ensure that the urine hasn't got signs of infection. So your urine test will be done at each visit. In addition to this is the fact that we want to know what the blood pressure is. Hypertension or preeclampsia is common more so in the very, very first pregnancy. And every contact a pregnant woman has with a healthcare practitioner, a midwife, or a doctor is an opportunity to check the blood pressure. Now, with the advent of home monitoring tests, mothers now do check this at home as well. So it is important. Now, the other thing we haven't spoken about is the baby. What happens during antenatal period? It's part of the screening process. We want to ensure that the baby is growing satisfactorily, that the growth of the baby is not restricted. And we get this, like I said, the woman would have had a scan at about 8 weeks to 12 weeks. Ideally, there should be another scan at about 20, 22 weeks. That second scan, which at times we call the big scan, BIG, is to look at the structures of the baby, the head, the chest, the hands and legs, just to make sure that there are no congenital abnormalities. That is, the heart is okay, the tummy is okay, the brain is okay, and that there are no abnormalities. That is very important. One of the things I have forgotten to mention is the screening for Down syndrome. Again, I'm not certain. I'm sure it should be available in Nigeria because there are private laboratories that can run this. Again, it's an area of ethical debate. Yes, if it's a Down syndrome baby, and so what? Some women, there's nothing wrong if a child is Down syndrome. They are just different from any other person, but they can also function in a certain way. I'm talking about will you terminate? And termination is not legal in Nigeria. Will you terminate a baby that has trisomy 21? So again, I won't go deeply into that, but it's available for who wants it. because we've got to realize the right of the woman to do what she wants to her body. But let's leave that as it is. Now, antenatal care really is about ensuring that through the journey and at the end of the pregnancy, we have a healthy mother and we have a healthy baby. Antenatal care is about dictating any deviation from normality. A woman is anemic, then you intervene. The blood pressure is going up, then you treat her for that and prevent potentially catastrophic events. Again, if the baby is small, you want to know why the baby is small. Does the woman need aspirin that might help with the growth of the baby? When is the optimum time to deliver a baby that is not growing according to its potential, natural potential? So these are the issues that we do in antenatal care. Now, in terms of the frequency of antenatal care, many years, and when I say many years ago, it could be about 10, 15 years ago, we used to say, come to see us every 4 weeks until 28 weeks, then every 2 weeks until you're 36 weeks, and every week until you deliver. It's been shown that those are too many, and you don't need all that visits to a health facility. And we are mindful of the transportation difficulty in Nigeria and in other African countries. So if a classification, if a woman is considered to be low risk, that is, there are no medical problems with the woman, then they don't need as many visits as what I have just stated. However, if the woman is considered to be high risk, then they need to see a clinician, a midwife, or an obstetrician more frequently. Now, one of the things that I haven't spoken about, which I just mentioned, is risk stratification. High risk women need to be seen by doctors. And high risk women could be people with very, very high BMI, obese women, women who've had previous cesarean section, women who were pregnant previously and the baby died. In such conditions, you will need increased surveillance by doing more scans during the pregnancy to ensure that the baby is in good health. And if not, then you intervene at the most appropriate time. So these are the elements of what we do in antenatal care. It's about ensuring the mother is well. It's about ensuring that the babies are growing or is growing satisfactorily, and then determining where and when to deliver the baby. Now, just to put out an appeal out there, traditional birth attendants have a role to play, but one has got to be very, very careful about this aspect, because we do know that if you do not refer patients when things are going wrong, then the outcome is going to be bad. If you refer them too late, then it's going to be bad. So it's either traditional birth attendants are trained in terms of infection prevention and control, or how to take babies, or how to take normal deliveries, how to manage bleeding mothers. Uh, if they don't have those training, I will not recommend a woman to be attended to by a traditional birth attendant, more so if there are health facilities, primary health care facilities, secondary health care facilities available in your environment. The other aspect is oh, God can do it, God can do it. There are situations where you hear that women have been in churches or maybe mosques where they've been in labor for days. And then when things are not going right, then they now think of, oh, let us send this mother to the hospital. And most often it's too late. So faith-based, I won't say clinics. The church is not a place to have a baby. The mosque is not a place to have a baby. The traditional worshippers is not a place to have a baby because they are not trained to handle things when they go wrong. Most women will have a normal delivery. So when you go to church and you have a normal delivery, yeah, that's but for the grace of God. But the problem is you don't or we can't identify when things might go wrong. And when they go wrong, then they can be very difficult. I'm sure we all have heard stories on the press and social media of women dying in pregnancy. Uh, it shouldn't occur really. Women dying in pregnancy, it's something that it's really, really sad. It impacts the children, the husband, the family, and I would say no. As clinicians, as advocates, whether law, I mean, when I say law, whether you are a layperson, let us advocate for better care for our pregnant women. I think the current government says antenatal care is free. Let us ensure that women avail themselves of the services that government has put in place. And let us hold our politicians accountable to ensure that they provide services that women can use. So, ladies and gentlemen, most of the issues that can happen to a woman in pregnancy are preventable. They are treatable. And so my appeal is that we should continue this discussion. We should continue to advocate for our women who bring life into the world and who, without that, the human species will cease to exist. So our mothers deserve the highest quality care that is available. So I will stop on this note and I will take questions if there are any questions. Thank you for listening to me.
Thank you very much, Professor, for that very insightful section. I'm sure we have actually all learnt some things that we were not aware of before coming here today. So always a pleasure to be further and further educated from you, sir. I know that we have a question from one of our online participants. If anyone else in the room has a question, please just put up your hands and then we will come and meet you. So let me just kick off with the online question, sir, if you don't mind. And she's also dropped her number, so I don't know whether if this is something that needs further discussion offline, it can be handled that way. So our online participant says, I had fibroid, which has been more than 7 years now. But during the time when I was seeing my gynecologist, he told me that if I could have more sex with my partner, it could shift, and then I can have my baby. Right now, though, she's separated. That's the main reason why she's not gone for the fibroid operation. So she would like to know what advice you can give her concerning that. I suppose it's a question of, does sex shift fibroids? All right, sir.
Lovely. Thank you for that question. Sex does not shift fibroids. About 70% of women will have fibroids. It becomes an issue depending on where they are situated and again depending on the size of fibroids. If they are affecting where the baby would normally stay in, then getting pregnant can be difficult. The other aspect that we look at in the antenatal period is if you have a fibroid that is more than 6 centimeters in diameter, then we have to scan the woman regularly just to ensure that the baby is growing accordingly or growing normally. So my advice to the lady who has raised that question, thank you for raising the question, is if you can liaise or link up with my GYNAE Issues Foundation, then we will be able to advise you on what to do. And that's why the foundation has been set up, is to be advocate for women. And please permit me, because I did not make reference to Lady Oyiko Ogundele, the founder of my GYNAE Issues, just to say a huge thank you to her for her commitment for what she's doing for women in Nigeria. So Lady O, thank you so much for your passion and your commitment for women's health in Nigeria. Thank you.
Thank you, Professor. And indeed, yes, we have Oyinkan Oshisonya, who indeed is the founder of My GYNAE Issues Foundation, very, very passionate about helping, women throughout, not just Nigeria, but wherever she can find them throughout the world, making sure that not only are women heard and women are given a platform and a safe space to speak to, but also making sure that, they get solutions, they actually walk away with a sense of comfort, with a sense of, of knowledge about, okay, where do I go from here concerning the issues? So thank you very much. And I know you'll have an opportunity to address the audience and to talk about some of your experiences and challenges and, blessings as well. So I would just like to ask another question, please, before we just pass the mic to you. Just a curiosity. If a lady, a mother-to-be, has diseases, for example, hepatitis or health issues such as hypertension, is it still possible for her to carry a baby healthily to maturity, or do those things in any way affect or possibly infect the baby?
Right. If we take hypertension, for example, now a woman who's got hypertension, it can affect the woman if it's not well controlled. She can have a stroke. If she has hypertension, it restricts the amount of blood flow to the baby, and potentially that baby can be growth retarded. That is, the baby is not as big as it should be because enough blood, oxygen, and fluid is not getting to the baby. But these conditions are treatable. So if we pick up a woman who has got high blood pressure during pregnancy, there are safe medications that can be administered in pregnancy. And like I said, such women are considered to be high risk, and so they are seen more often than if they didn't have hypertension. So it is treatable. Now, when we talk about infections, I made mention of having recurrent infections, water infections. Again, that is treatable with safe antibiotics, safe for the mother and safe for the baby. When it comes to HIV, again, that is treatable. The mother can be treated, and preparations are made to ensure, it's the same for hepatitis B, to ensure that the baby during birth doesn't contract the infection. So in certain situations, people do advocate that mothers are delivered by cesarean section so that the baby does not contract the viral or the virus. The other aspect is group B streptococcus. That is very common. It's not an abnormal bacteria, but it lives in the vagina. The only thing is, if a woman has it and we don't know, and the baby gets it, then it's one of the conditions that can seriously affect babies. So if a woman has got strep B infection, we need to know, such that after the delivery, before the delivery, they are given antibiotics by the time they are going into labor, and after the delivery, the baby doctors, the pediatricians, check over the baby And if they need to give the baby antibiotics, again, that is put in place. So most of the potential problems that can occur in pregnancy are treatable. And that is why we are advocating, again, repeating myself, that women should avail themselves of healthcare facilities, ensuring that the personnel in those facilities are trained people and not just quack healthcare professionals. Thank you.
Thank you, Professor. Okay.
All right.
Please introduce yourself and ask your
Okay.
question.
I'm Hade Ronke Lakin from Rotary Club of Sharing Notes. All right, so my question to Prof, please. I want to have clarification about my personal experience, if I should actually approach a health facility. Actually, before I had my first child, I was having a good flow, maybe 2 days. Then after I had my first child, my period ceased. And 10 months after, I got pregnant after having an CS, cesarean session. And it was automatic CS for me again because I was pregnant with the second child. So I had 2 CS in less than 2 years. And my period still ceased after having the second child. So I had to go in for family planning so I don't have children, even though I'm not seeing my period. So coming today, one of my concerns is that since I started using the family planning method and I started with injection, those injectables for years, and just about 2 years ago, I changed to the implant, and I've still saw the period maybe like once in 6 months and very tiny. So I'm concerned. That's why I came, that I need to know, should I approach a health facility to find out maybe anything is wrong with me, or I should do scan, or I don't even know. People say fibroid. I don't even know. Is there a way to test to check if you have fibroid, or what are the symptoms, what are the things you should check out for? That's one. The second one is about the safe termination of pregnancy. I know you mentioned in your speech that in Nigeria it's not yet acceptable, is illegal, but I belong to an NGO that we also advocate for such. We've tried to pass in different ways that the governor should give opportunities for women through the health facilities, that the health doctors that knows that if the life of the woman is at pregnant after the first 2 CS, I can walk in with my husband and say, this is not safe for me because I also had preeclampsia. Why can't I terminate the pregnancy? Because it's not going to help me at that point, because I had 2 CS in 2 years. And imagine I got pregnant with the 3rd one. Why can't we approach a health facility? I want to find out, is it that because of the dilemma or the government, or what are the ways we can push it? Because it's one of the things we are advocating as CSOs, to see the government, to see how they can pass this for women that their lives might be at risk. Like me, if I had that, maybe I didn't go for family planning. So I really needed to help me in these 2 areas, for my personal and the other one for the checking of my health or the safe pregnancy. Thank you.
Lovely. Please, before you sit down, may I ask you, after the first baby, or when you had your first baby, were you breastfeeding?
Yes, I was breastfeeding. Then I had
Right.
breast lumps. Yes, so I did operation. I didn't even know I was pregnant. It was when they wanted to do the breast lump operation that they found that I was 8 weeks gone.
Right. So breastfeeding prevents women from having periods. So if you are breastfeeding, for as long as you're breastfeeding, you may not have periods. But that doesn't mean that at some point in time you wouldn't fall pregnant. That's probably what happened to you when you didn't have periods for 10 months, only to find out that you were pregnant. That's because we know that lactation can affect ovulation. So that's what happened to you. And again, falling pregnant so soon after a very first cesarean section, I wouldn't say it's a problem to worry about. Women, it happens to women, they're not planning a pregnancy and they fall pregnant. Healing of the scar, you hear things like, don't have a baby for at least 1 year after a cesarean section. Well, I mean, that's ideal. But healing takes place within, we usually say 21 days, but let's even stretch that. So having a pregnancy 10 months after a cesarean section is not something that really one would worry about. And again, it's not an indication. It's not an absolute indication for a repeat cesarean section. These are the issues we have to discuss in Nigeria. I know people will say, oh, you've had one section, you must have. No, they must explain to you why you must have a cesarean section. If it's because your pelvis is small and there's a disproportion, if you have a big baby, then definitely that or subsequent babies will not be able to come out because your pelvis size is not going to increase. But we can, I mean, I can go on and on about this because every woman is different. So, like I said, the pregnancy you had 10 months while you were breastfeeding is due to the fact that you were breastfeeding and you didn't have a period and a pregnancy occurred. The second question I think you made mention about is the CSO role. By the law of the Federation of Nigeria, abortion is illegal, but we do know that it's taking place. We do know that it's taking place. But the question is, and like you rightly said, if that pregnancy is going to put the health of a mother at risk, then there is a place to advocate. And this is where we as a foundation, you as CSOs and NGOs need to push for a bill in Nigeria, in the parliament, in the Senate, or House of Rep, that for situations such as that, where a mother's life is potentially at risk, then there should be consideration for, I use the word, there should be consideration for termination. The religious organizations will tell you or will tell us that you are destroying another life by undertaking abortion. So, like I said, it's an ethical, moral, spiritual area in terms of abortion, because people will tell you that you're killing a baby when you go for abortions. So the key thing is to ensure that you do not fall pregnant if you are not ready for a pregnancy by use of the appropriate contraceptives. So I think that's the key thing. It's going to be very difficult in Nigeria to pass an abortion law because of the religious traditional aspect. But the key thing is contraceptives are available. Let's promote that to our young ones. Let's start talking to our young ones about sex from a young age, not the ones where you tell somebody when they start having their periods that if a man touches you with their hands on your shoulder, you'll fall pregnant. No. Let's tell them, even before puberty, what sexual reproductive health is about. So I hope that answers the question. And again, if you want a third baby, there's no reason why you cannot have a third baby after 2 cesarean sections.
You know what?
So,
You
but
know.
we can take that discussion. We can take that discussion outside of this place through my GYNAE Issues Foundation. We're happy to discuss that with you, since it's personal and confidential.
Thank you very much, Professor. And you know what they say, there's always that love child that comes unplanned at the end. So. All right, okay, we'll come up to you, ma'am. Please go ahead with your question.
Good morning, everybody. Sorry, good afternoon, everybody. Good afternoon, doctor. It's was a very wonderful and rich lecture. My name is Mrs. Nweke Stella Talatu, and I work with the National Youth Service Corps. I am not the head of Lagos State, and the head of Lagos State is the state coordinator. But I work in the scheme, and I am presently working at Ogun State, Abeokuta, the area office, as a deputy director in charge of community engagement and entrepreneurship development. While in Lagos, I handled the skill acquisition and entrepreneurship development. That's where I met the woman that invited me over here. And I'm so very, very glad to be here. You see, while growing up as a young lady, we were not told so many things. This is a very brilliant lecture, and please, I want to request that you push it out to very young women. We got married, we were not even told anything. It's just that naturally when you are a woman, there are certain things that you just, just come up like that without you being told what to do and all that. And I got married and I had my first child. I had pre-eclampsia. I was very, very sick. I went into the eclampsia state. I had protein. I had edema. I had high BP. And I was they did cesarean section for me to bring out the baby because I was going into, the eclampsia state gone that morning when I was sectioned, and I brought out my baby, and my BP, everything went down. And then I got pregnant for my second baby in less than a year and 3 months. Yes. And I was very, very scared. I said, no, they should remove the baby from me. I don't want. Because I thought that every pregnancy will be the same. I was very, very scared. And then I was working in the bank. And while I was in the bank, even when I was very, very sick, I had my all the symptoms of pre-eclampsia. My manager did not let me go. I collapsed in the office and I was rushed to the hospital. Then they called my husband to meet me there.
The microphone is not working.
After 4 years,
Hello.
Better, thank you.
okay, all right. Then I had my second baby. I was pregnant for 1 year and 3 months. I was pregnant for my second baby. I had my second baby, and it was a boy. And I now said I don't want anymore, since it was also a cesarean section. I didn't have any problem at all. But just few weeks to my EDD, my son went to school and had poison. He drank a bottle of Coke that had caustic soda in it. And so we were hospitalized with my pregnancy. I didn't sleep. They didn't see vein in his body. They had to put the drip on his head. So I was alert, awake for 5 days, no rest. And so I went into fake labor. Before then, they had to section me again because my baby went transverse. So I now said I don't want anymore. And then after like some few years later, I said, oh, there are 2 boys. Let me try maybe to be a girl. So I got pregnant, 3 years and some months. And when my last baby, my second baby was 4 years, I had my baby. Through what? Through cesarean section. Because the doctor said, I've gone through 2, they will not let me go through another one. That is the normal delivery. He tried to explain to me, if you stitch a cloth, you lose the cloth, you stitch the cloth again the same place, and then, So I said, okay, no problem. I don't have any problem. My pelvic was good. Everything was good about my health. But it's just all this problem I had during pregnancy. And so I had my baby without any stress because they didn't allow me to get even to that 9 months proper, because my doctor said he was traveling, so he needed to bring out the baby, and then that was it. So I brought out my baby, even though I had to quarrel with my husband, my mom, everybody. Let me try, I can do it. But they refused. So I did the third cesarean section and I had my baby. When I went to do the third cesarean section, I met a woman that came for her 5th cesarean section. The babies were all alive. So you can still go and do your own. It doesn't matter. No. It doesn't matter. Yes.
Thank you.
Yes. So what I'm trying to say in essence is that we don't have to be afraid of anything. If you have a good doctor that will take care of you, you can make it up to the 5th time. Yes. And then our young girls should also know how to take care of themselves. When they're about to get married, they should be taught all these things so that they know how their body circles, the differences in their body and all that before, they start having their babies. Then I also want to, sorry. I'm taking too much time, sorry. Doctor, what I want to ask is that I am AS and my husband is AA, and I am AB positive, my genotype, and my husband is O positive. But my first son is O negative. What happened? Thank you.
What happened, Professor? Wow, an amazing one. I guess Professor is still there. If you still have your questions, please get ready. Over to you, Professor.
Yes, thank you for that. I think you have answered some of the questions, and that's why I raised my hand, clapped for you. You said you know of a woman who's had 5 cesarean section. So that's just to show you that women, more so when they are under the care of a doctor, can have more than 3 cesarean sections. It was many years ago that we say, if you've had 2 cesarean sections, then the 3rd one must be a cesarean section. And that after the 3rd cesarean section, then that you shouldn't have more babies. But again, that is no longer the case. If you've had 3 sections and you want more babies, you will be looked after to ensure that things don't go wrong. Again, I can't go into depth, but like you have rightly said, you've seen, and I've seen people with more than 5 cesarean sections. If there's no infection, the stitches, suture materials we use now are much better than what we used in the 60s and in the 70s. And again, nutrition-wise, women are healthier, so healing is better. Now, you made reference to preeclampsia. Preeclampsia is something that is peculiar to human beings. When you're married, your husband is carrying genetic material that is different from yours. The child has some of your own genetic material and some of your husband's genetic material. And your body recognizes that there are genetic materials that are not your own. And like you rightly said, after that baby was delivered, your blood pressure went back to normal. So it's something peculiar to women in the first pregnancy. And you may recall that I said every contact you have with your healthcare professional, we should be checking your blood pressure or the blood pressure just to make sure that it's within the normal range. One of the things that worried me in what you said was that your doctor said because he was traveling, he or she was traveling, they have to deliver the baby. Well, I don't know how many weeks you are, but that shouldn't be the driving force unless you had got to maturity. But if that baby hadn't got to maturity and because the doctor was traveling, wanted the baby out, what about if that baby now suffers from prematurity ends up in intensive care, baby intensive care unit, you won't thank that doctor. Again, that's why I said choose your doctor. And don't forget, cesarean section, you pay more for cesarean section, and the financial benefit to the doctor at times is the driving force to say, I think, oh, you should have a cesarean section. But have they told you of the risk involved, potential risk involved of having cesarean section? Injury to the bowel, injury to the bladder, injury to the ureter, clots in the legs, clots in the chest, and even death. So it's not a matter of you must have a cesarean section. A woman, it's your body. They give you the information and you decide what you want. Discuss with people, family, or that you can go for a second opinion if you want to. And I think, yeah, um, there's a resource negative one I will not address. I don't know what's going on. Just let's leave that as it is. Maybe again, it could be that the laboratories have given wrong results. Some laboratories
Okay.
are not really accredited and they'll just write any report out for you. My suggestion is perhaps both of you should check your resource factor again in reputable laboratories. Thank you for the question, and I hope I've addressed them.
Professor, I have a question. The role of the men in this. Okay, the role of the men in this. What can we do? Most of the time, the women will go for the antenatal care, and we're just there, go and come back. What should the men do? How can we be involved? Because you mentioned we don't pray for it, but the rates at which women lose their lives during childbirth is alarming. So the men can't just sit back and watch. What should they do? What should they look out for? What questions should they ask the doctors when they're going for those programs so that they can ensure that their wives are alive and well? Thank you, doctor.
Lovely. Thank you for that. Knowledge is wealth. Knowledge is wealth. Yeah, that's what they say. Where most of us are now being educated, we've got AI, we've got Google, Dr. Google. You can read about these things. And before going for a consultation, you can write whatever questions you want to ask. I will recommend that, if possible, more so if it's a high risk pregnancy, that men should accompany their wives for antenatal care. It can be difficult if you are holding a 9 to 5 job where you're not allowed to go, but you may have to take a day off or something like that, or half a day off to attend the clinic. Or if your facility runs a weekend service, then you can arrange to have your antenatal care on a Saturday morning, afternoon, or evening. But men really, really should get involved in pregnancy. Men really, really should be in that labor ward to see, not just to see what women go through, but to support their wives through the journey. So it's not just about getting a woman pregnant and you sitting at home waiting to be told that, oh, yeah, the baby has come. Let us support our women when they go through this journey of pregnancy. It helps with bonding. It helps with the marriage. Again, some men want to cut the umbilical cord when the baby is born. It shows they are present. So, thank you for bringing up that question. Let's keep Rotary Club has a role to play in this as well to encourage men to attend antenatal clinic when and if they can. Thank you. And just before I mean, again, if you cannot attend with telemedicine now, you can be in your home and say, Doctor, please, can I give you a call through WhatsApp or whatever, just to discuss what's going on with my wife? or if there's a telehealth service or platform, then you can use that as well. So let's use the technology available to us if we cannot go physically. Thank you.
Okay. Hello? Is it audible? Okay, thank you. Okay, thank you so much, Professor Rotimi Jaisimisa, for the insightful um, session. So, my question is more of like a storytelling, but I'll be very quick with it. And I'll start with saying that I know my mother being a fibroid patient. I know how much she go through the struggling and doing surgery for her and all that. Now, I want to ask, I'm kind of seeing symptoms, and I don't want to assume that it is hereditary. I don't want to assume that I'm seeing the symptoms. So I want to be sure, what are the symptoms to see, and is it like 100% hereditary? So that's my question, Professor.
Lovely, thank you. Fibroids are hereditary, but in life, there's nothing absolute. There's nothing like 100%. So because mommy had it, doesn't mean that absolutely you are going to get it. And like I said, 70% of women have fibroids. So more likely than not, the genetic factors may mean you are at risk of when I say risk, in a positive way, of getting fibroids. So what I will suggest to you, see a doctor early, have an ultrasound examination to check whether there are fibroids there. If there are fibroids there, it can explain the heavy periods. And again, there are so many women with fibroids, and the very first time they will even know they've got fibroids is when they are pregnant and they go for their first scan, and the doctor or the scan people say, "Oh, you've got fibroids." So it's not the end of the world. Like I said, an early presentation, early investigation helps. So my advice to you, like you said, you're developing symptoms similar to your mother, is to arrange to have a scan done to check. It may tell you, it would tell you whether you have it or not. Thank you.
Okay, ladies and gentlemen, I know we want to ask lots of questions. We don't know how many minutes the professor will still have, but we will entertain more questions. If we can't take all the questions today, you can write them down. So, okay.
Okay. Hello, everyone. My name is Amaka Olubayo, and my question is still about fibroid. First of all, I've always, right from when I started menstruating, I've always had very heavy flow. And until when I got married, I had my first child. That was when the doctor told me that it seems I had fibroid. And then it went on like that. There was no issue. But the heavy bleeding continued. Normally, the first day it will be just normal. Then for the second and third day, to a point that most times I make sure I don't go anywhere. Even if I have to go to work, I stay close. I sit close to the toilet. I stay close to the toilet. That's where I walk all through. So I've stopped having children. Maybe, I don't know. But for me, I have stopped completely because I'm over 40 already. But I want to ask, okay, last year I had a scan. And the doctor told me, he's not a gynecologist anyway. It was just my normal routine check. And he told me, he asked me to go for a scan. And when I brought the results, he said to me that it is not the fibroid, after going through the result, he said it is not risky enough to have a surgery, that we should just keep watching and all that. But I thought after having kids, after having children, the heavy bleeding should have stopped or should have reduced. So what could be the cause, since the fibroid is not enough to have surgery to remove it? Thank you, sir.
Professor, I hope you got the question. Did you get the question, sir? Okay. The professor is muted.
Yeah, thank you. I was muted. Um, what was I going to say? Yes. Um, you were told that the fibroid is not risky enough to for surgery. If you have small fibroids, yeah, you've got to weigh the balance of the surgery can be highly risky. Like I said, people can die from surgery. Things can go wrong. So you've got to balance, and we said 70% of women have fibroids. That doesn't mean 70% of women go for surgery. There are other ways that if it's the heavy menstrual bleeding, there are things that can be done to control or reduce the heaviness. There are tablets that you can be given. Today is not about consultation, and that's why I'm not mentioning names. There are insertions like the coil Mirena that can be used to reduce the menstrual flow. But if the fibroids are not big, then you do not need surgery. The only time you will need surgery is if you've tried simple things first. The tablets, the Mirena, maybe ablation, and it's not working. And then it's affecting the quality of your life. Then that's when you earn having surgery. So surgery is not the first port of call. So your doctor has really advised you correctly. And like you said, the other thing you said was the very first time you knew you had fibroids was when you were pregnant, which is what we were saying is that the first time people will know that they've got fibroids. Am I there? Hello? 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 Can you hear me?
Yes, sir.
Hello, can you hear me?
Yes.
Hello?
Yes, we can. We can hear you, Professor.
Right, it's just my screen. Okay, I'll keep talking. Yeah, so like I said, lots of women have fibroids and they don't know they've got fibroids. And the very first time they know is when they have their scan in pregnancy. So my GYNAE Issues Foundation is there to help women. So if you have questions, please reach out to my GYNAE Issues Foundation and we'll try and link you up. If we cannot advise you in-house, we'll connect you to a doctor externally. So thank you.
Thank you, Professor. Okay. Thank you very much for time. We know that we have grossly extended the time that you had available for us, so we're very grateful. And just like you said, we will collate questions that we have for, my GYNAE foundations to answer. So please do make sure that you get a piece of paper from, where's Auntie Bolanle? You can get a piece of paper, pen down your question. Please make sure that it's given to my GYNAE so we can be sure to get back to you along with your email address. Sir, we are very grateful. Thank you. I have to ask someone who owns a Highlander with registration number BDG893GZ, ash color, to please repark. It is blocking, it's causing an obstruction. So I hope the owner has heard that and can please relocate that car. Okay, so just nuggets from what Professor said. He said so much and it was very rich, but some key takeaways that please, no matter what issue you're facing, no matter your curiosity, do see a good doctor. It is the difference between life and death. For surgery, for anything, inquiries that you have, curiosities, very, very important. And the other takeaway as well is my GYNAE Issues Foundation is really here. They have a vast network of doctors, professionals, experts they speak to who can also give you consultation and answers that you need. This lady's example, I'm sure Incon will probably talk a bit about her own experience, which is quite similar to hers. And then, we'll be able to press on. So we are going to be moving on now to the next session. We are very fortunate now to have
Wow, the mics are really acting up. I guess it's a gynae thing, a female thing. Okay, probably the mic wants us to stand here together. Moving on to the next, we're going to have a discussion here, and privilege to introduce to you the founder, the young lady that's so energetic, that has that passion and bringing everybody together. In fact, she'll be on your case if you don't move. This lady is passionate about women. It's all about women, empowering women, and that's why we're gathered today. We celebrate her tenacity to stand in that field to bring awareness to the cause of women. Ladies and gentlemen, make welcome Miss Onyekon. Put your hands together for her. I would have loved to read her profile, but her profile will take forever. Once again, ladies and gentlemen, put your hands together for Miss Onyekon.
Good afternoon, everyone. I'm so excited to see you all. Thank you so much for coming. Thank you for honoring our invitation. Every time people, thank me or praise me for the things that we do with my GYNAE Issues Foundation, it's always an opportunity to thank God, for giving me this privilege, because, me being alive and being here and being able to convene or, gather people together is just by the grace of God. When the NYC coordinator over there was speaking, I could relate with her story, because what she shared about having preeclampsia is something that my mother experienced over 46 years ago when I was born. So it baffles me in this day and age that Nigerian women or women all over the world, maybe perhaps, are still battling with issues regarding high blood pressure. My mother had me at age 21. She was very young, actually. And by the time she made it to hospital, the doctors, the midwives, everybody was, almost perplexed because she was unconscious. By the time, they checked her, even I was in distress. So like I said, it's very, very baffling that, in this day and age, we still have issues like that. So, I'm very happy that you raised those questions. And even today, I also met a lady, or I spoke to Mrs. Daramola, and she was actually saying that, our own high blood pressure is usually after pregnancy. So after she's giving birth to a baby, that's when the high blood pressure develops. I didn't even think that was also possible. I thought that it only happens during pregnancy. So you see how complex, I don't want to call it complicated because it looks like that's a strong word. So, just women are we are phenomenal. And so I'm very happy that everyone came. When I first, grew up, when I was growing up, the first passion that I had was actually about maternal health. So it's the reason that we're sort of, delving into it and making sure that we're speaking more, about maternal health. Prof, enlightened me and said that maternal health actually, consists of gynecology and obstetrics, or maybe obstetrics and gynecology. So, gynecology is like a branch of it. So talking about, women, pregnant women, women who are, going to have their children is very, very, very dear to my heart. Like I said, before anything, when I thought about, being able to have a child, that was the first thing that came to my mind. So every time that I hear that a woman has, gone through these issues, it just pricks my heart, and I really feel like, we can do something. So I'm here to encourage everyone, if you know any pregnant woman, if you know anyone going through, even fibroids, because I also had a fair share of issues with fibroids. So I'm here today as somebody who God has just helped, who's here by grace, because like I said, if my mother didn't make it, I had to be pulled out with forceps, because like I said, she was unconscious. If she didn't make it then, I wouldn't be, if we both didn't make it then, I wouldn't be here. And then after that, also going through fibroids, was also, very stressful. So I'm really grateful that we have the opportunity to listen to, somebody come to talk to us about, the things that we need to do. How can we prevent these things? Is it possible to, change our diet? Is it possible to make sure that the things that we ingest, the creams that we use, the hair products that we use, can we look at how these things affect us? I'm also, glad that, Dr. Rama is also here to speak to us about menopause, because that's another issue that women are dealing with that they don't understand, People ask me, the other day I was in church, and women, I could tell that all those women were over 40 because they all had, a fan like this, and everyone was just, and I was, oh, well, poor women, they are going through a lot. We go through a lot. But, we thank God for the opportunity to be here. And I think, a gentleman also asked, how do men come in? Somebody also asked me that, who is talking about the men? I think it's also time to begin to speak about, men, because apparently men also go through, certain things, when their wife is going through all these issues, they're also going through some, mental health stress. So I think, just being here is being able to convene, doctors and people who've experienced things and just sort of rub minds together and, advise young ones. I'm also glad that, we have young Rotaractors here. We have students. And so, yes, it promises to be an insightful time. Please don't go. We have a lot of things lined up for you. There's a pamper session going on at the back there. There is, free health checks, so you can check your blood pressure, which is very, very, very important. People are living with, high blood pressure. Yesterday, I heard about a woman who was reading her, a holy book, and before she knew it, she was gone. So it means that that woman actually had some pre-existing condition, like some underlying issues that wasn't properly checked. We have an opportunity of a photo session, a pamper session. So please, just stay with us, and it promises to be insightful and exciting. Thank you so much to Rotary International District 9112 for this privilege. And I also want to say thank you to the team at my GYNAE Issues Foundation. You guys are phenomenal. Thank you for all the work that you do. Yes, and, I'll be speaking again, about safe spaces, so I would like to, nip it in the bud right here so we don't take too much of your time. Thank you so much for coming. God bless you.
Thank you very much. This is Oyeko, our founder of my GYNAE Issues Foundation.
It's working. I think the mic wants us to be here. Founder herself. Imagine. So men. So what do you think about this GYNAE thing? Men should go into the labor ward and just see the. I see the Dr. Go into the labor room. So we would learn to appreciate our wives better. If all the women want that, say aye. Right, they have it. All right, men. Yeah.
I actually have a question for the men. When he was talking about how some men want to cut the umbilical cord, how many men actually knew that you have an umbilical cord to cut? Hands up. Nobody? Okay, I thought that was interesting. I remember when I was, first finding out about delivery, and I went to a hospital, and I just noticed in the delivery ward that there was a man lying on the ground. And so I asked the nurse, I said, what happened? She was like, the man fainted in the process of delivery, so we couldn't stop the operation halfway, so we just had to roll him over to the end of the room. So it's quite interesting. Even in my personal experience, I remember that when my daughter was pulled out, that her father was looking anywhere but at the baby, and he was like, how come you're not frightened? How come you're not terrified? Anyway, it's all very interesting. Okay, so I hope we're having a great time and learning a lot. We have an expert now to invite up. That is in the person of Dr. Rama. She is Dr. Rama Akachuku, forgive me. She is going to come and talk to us on the topic of safe delivery and postpartum care, reducing maternal mortality through appropriate prescriptions and post-delivery care. So please, Dr. Rama, we would like to invite you. Let me just give you a snippet of her very prestigious bio. Apologies. Okay, it's Okay. So Dr. Rama Akachukwu is a family medicine consultant with specialist expertise in menopause, hormonal health, and adolescent medicine. She graduated with her medical degree from the University, I got this the first time, Debrecen, yay, Hungary in 2012, and completed extensive training in Ireland, earning membership of both the Royal College of Physicians of Ireland in obstetrics and gynecology and the Irish College of General Practitioners. She has over 12 years of international clinical experience, and she is also certified in cervical screening and contraception with additional experience in urogynecology. She is the founder and lead consultant of Aurelia Health Clinic, a global virtual clinic that provides comprehensive women's healthcare worldwide. Her mission is clear, and I'm sure she'll explain it further herself: to empower women at every stage of life, helping them navigate hormonal changes, reproductive health, and well-being with compassion, expertise, and innovation. So please, let's have a round of applause for Dr. Rama as she comes to speak to us on that topic. Okay. All right. So please, could we have those who are back? Could we have those who are at the back in the Pampers section please come to the front and, take advantage of this opportunity to learn? Please let us do that. We can always reconvene with the Pampers section later. Thank you so much, Dr. Rama.
Good afternoon, everyone. I want to thank you for coming out today. Because and I know how busy, and I know how. Sorry, Bluetooth. So I'm trying. Yeah, so I know how busy Lagos can be. So thank you. I also want to thank Lady O. That's the way I call her. That's the way I know her. For fighting so hard for every woman. I've only known you for the last 3-4 months, but I can see your passion, and God bless you. I also want to GYNAE Simi. I think I said it the last time we had my GYNAE 2.0. It's very rare to see a man acknowledge women like you do, sir. And I'm happy you're Nigerian. Kudos to you. And I'm also very happy that there are men in the building today. So just not 1, 2, 3, it's almost 50-50 in the room. So thank you all the men for being here. Thank the Rotary Club 9111 9112. Sorry, I'll do that. Thank you for the opportunity, giving us the fully AC'd room. Even though I just relocated, I'm shaking in cold. So thank you so much for that. So I'll move on because I've been given 3 topics to talk about after delivery care, and also to talk about when women's life is from, when they stop having their period, what happens.
Mike is in support of the men.
Okay, can everybody hear me now? Okay. So I think the first topic they wanted me to talk about was safety post-delivery after a woman has birth. I think going from Professor going from what Professor already said, the most important thing is don't miss your antenatal appointments. Since I started working in Nigeria, one thing I've noticed is that they come in for the first scan within, let's say, 6-7 weeks, and they're happy that they are pregnant. Then the next time we see them is at 20 weeks, so that is known as the big scan. Again, they're happy.
hold on, please.
One, two, oh, beautiful.
No, it's okay. So I was saying that from what Professor Jaisimi said, the antenatal appointment is very, very important. So for a woman to achieve a healthy delivery, which is possible for every woman worldwide, not only Nigeria, you need to take your antenatal appointment very dearly. I also appreciate men coming for their antenatal appointment. I'm a kind of doctor that I don't just look at the woman and talk to the woman. I look at the husband or the partner or the brother who is supporting or the uncle that is there and let them know what is going on with the woman's body. So the antenatal appointment is very important. I was saying for the 20 weeks is when we have the big scan. So we're looking at the baby's head to toe, counting fingers, counting toes, checking the heart, the liver, the kidneys. If we find anything unusual, again, it can be managed or even treated, or even and that also prevents delivery issues for the woman. So one thing I've noticed coming back is that unfortunately they come for 20-week scan and they don't come back. So they come back either with the baby in their arms or they come back in labor. So my advice is please do not miss your antenatal appointment. For husbands, uncles, brothers, if you know that of your sister that is pregnant, check on her. So I'm just going to run through the antenatal appointment. So once they are pregnant, they should see the doctor immediately, get bloods done, and then after 48 weeks, they should be checked. Blood pressure, urine should be checked again, and they should be registered. So it's not just check and go home. So they should be registered. So what you should be asking the ladies is, where are they going to have their babies? So which hospital are they going to have their baby? Not just where did they go for a blood test, okay? And it should be regular. They should go, at least in Nigeria, because of the comorbidity. So what do I mean? Because there's risks of blood pressure, there's risks of gastritis or peptic ulcer, there's risks of diabetes, which is a big one, and even uterine fibroid that most women don't know they have until they are scanned by a good sonographer, you know, that they are aware that they have fibroid. So they need to attend more regularly than it is in the Western world, okay? So for a woman who has gone for all antenatal, her antenatal clinic, she has a better outcome of having a safe delivery. So like Professor Jayesimi said, you can have as much cesarean section, regardless of how many pregnancies you carry. The most important thing is that it's done by a doctor that is aware of the risks that it comes, and you are managed appropriately. So let's say the woman, I can just give a case. So let's say you're seeing a 42-year-old lady who has given birth to her fourth child by cesarean section. She's day 3, no issues throughout. And just before she was discharged, she complained of headache, and she was checked by the midwife, and her blood pressure was high. Oh, I think it's back on. So her blood pressure was up, but because of the cost, she decided to go home. So because of the cost, she decided to go home. But I think this is where the partner plays a huge role. Again, not to scare anyone here, but if that woman goes home, she might die. Okay, and then you might be left to to look after that baby. So that's why the husband should be involved from day one. Okay, so if that woman is having blood pressure, I would advise, and you love her as your wife or she's your partner, I think you should make Okay, sorry. Sorry, I'll browse this quickly. So what I would say is that if the man is involved, then that could also help the woman stay. These are cases that I've been involved with myself. Sometimes the woman is like, no, honey, we don't have so much money, we just need to go home. But because the husband has been involved from the beginning of the pregnancy with me till the end, the husband knows what is going on, and the husband can find a way, you know, to help with that consultation to save that woman's life, and her blood pressure can be managed. Things that we screen for women that has given birth, again, we make sure that the blood pressure is monitored. Again, people could have pregnancy post-delivery hypertension, even though they didn't experience hypertension in pregnancy. It's very common in Nigeria. Again, if for women who have delivered vaginally, they could have issues passing urine. That could be due to bladder injury during labor, especially prolonged labor, where a woman is finding difficult to urinate or she's even urinating a lot, okay? Another thing that could happen is uterine vaginal prolapse, where the vagina is coming down. And this is, excuse me, this is very common in Nigeria, but a lot of women feel stigmatized or embarrassed to talk about it. My lovely guy, Mr. Isaac, did I get your name right? Israel, sorry. I love the way he's always engaging that, oh, how could a man play a role in this? So again, that's what I'm saying. The man will not be able to play a role if the woman is not able to communicate to her husband. Okay, most men would like to support us if we can only communicate to them. Okay, so I'm going to jump to the perimenopausal and the menopausal aspect, but I'm happy to take any questions at the moment. Okay, I see a lady. I'll just walk up to you because this is the only mic working.
Thank you, doctor. My name is the fibroid is very massive and is right there inside her uterus. So now she met a gyno to see if she could do a surgery or something. And he told her that, well, after the scan, he told her that he's going to open her up. And if he gets in there, he's not able to do the surgery, he will just close her back. And she's asking, is this worth taking the chance? I want to know, what's your thoughts? What do you think? And then my second question, I'm a triplet mom, and I had my babies through surgery, a C-section. After that surgery, I had this earth-quaking cold. It was so intense, as if I was going to die. I just want to know, why does that cold happen? Does it happen to everyone? Thank you.
Thank you for your questions there. For your sister, first, she's a very strong woman being diagnosed with uterine fibroid, endometriosis, and ovarian cyst. The advice I will have is for her to seek a second opinion. An ultrasound has been done, it's been diagnosed the uterine fibroid, but I would recommend her getting an MRI. Yes, and it's better if she gets the MRI with IV contrast. So it shows us where the fibroid is, it shows us the size of the fibroid, it shows if it's also pushing again other structures, and it also shows more on the ovarian cyst. Then with that can give the gynecologist more information whether to go ahead with the surgery or not. If the gynecologist is saying he will open her up and close her up, there's a huge risk of surgery. Okay, so her going for surgery, she's going to be having that surgery, I guess, asleep. So there's a risk of anesthesiology. There's risk of bleeding, because with uterine fibroid surgery, the bleeding risk is very high. So bottom line is she needs to see a second gynecologist for second opinion, and she needs to get an MRI. Okay. And also to speak to a fertility expert in terms of her egg reservation. If she's thinking of freezing her egg after getting the surgery done, or because the surgery will also come with risks. So it's to have all those discussions done. Okay. Then in terms of your question, the second personal question, you said you had triplets by cesarean section, and you had intensive cold after the delivery. Okay. There are a few things that could cause that. It could be the anesthesiology that was, the anesthetic, solution that was given to you. That can cause temperature drop, and it can cause hypothermia, which is an intensive cold. It doesn't happen to everyone. Most anesthesiology, I don't want to look like I'm throwing shade, but most anesthesiology are aware that that might happen, and they prep for it in advance. So they're checking your temperature, they're seeing it drop from 37 to 36, and then they keep you warm. So there are warm blankets that they give you, or they give you a warm solution to prevent that. But in Nigeria, every intervention you get, there's a cost to it. So it's not like the Western world where things like this are covered. So they might not ask the lady because the lady might not want to pay for it. So all they are interested in is make sure she's pain covered and she has her baby safe. I hope I answered your question. Okay.
Thank you, Dr. Babasanya Olabisi from RC Sherry. So I want to start from what she said about the code. Like, I had my daughter 14 years ago. So, and after the delivery, there's this blood coming all over. So at a point in time, okay, I gave birth early morning, like 4 a.m., and the blood did not stop until evening. They now took me back to the theater, where I learned, because at that time I learned they flush my womb, you know. I had blood transfusion, and since that day up till now, like, I knew something is missing in me. So after like a week, I had this cold that she mentioned. Like, after a week, we've had the naming ceremony and all that, and I had this cold, like, I felt I'll just, you know. So, and since that time, up to this present moment, I've not actually gotten myself, because I knew something was, I don't know what was wrong, and I've complained to them and all that. So, she's a girl, and I actually want to be a grandmom very soon. So, I don't know why that code. Our own is immediately after. My own was a week after. That's number one. Then I want to ask, is it normal for someone that just gave birth to undergo flushing of the womb again? Thank you.
You're very welcome. Thanks for the question. So I'll start with the second one. It's not normal for someone who has just undergone a delivery to have flush of the womb. I don't know what happened then. Normally, we don't just flush out the womb of a lady after giving birth. Okay, so you were bleeding continuously. Okay. Again, that can happen after delivery. It could happen after vaginal delivery or cesarean section. It's known as hemorrhage when a woman is bleeding after delivery. So it's known as post-hemorrhage. Okay, post-delivery hemorrhage. There are so many things that could cause it. It could be a bleeding uterine vessel, okay, that wasn't identified during delivery, and that's why you were bleeding. Okay, there are ways of treating it. So going back to basic, and that's why Prof. Jayesimi was saying, even though people want to give birth at home or they want traditional people to give birth, they should be aware of how to treat cases like this. So the first thing we do is when a woman has given birth, we rub her uterus, because we want the uterus to contract to prevent bleeding. When a woman gives birth, even if there are no significant tears, the vessels have been dilated for hours, especially in prolonged delivery. that can cause bleeding. The placenta has been taken out. Where the placenta attaches, those areas are vessels, so they're like taps. Okay, so that's why that contraction of the uterus is done. So I guess what they were doing back then was trying to use water to clean a well that is leaking out, water. But unfortunately, that was what was done at that stage for you. I think the intense cold you had was because you were anemic, so hypovolemia that led to hypothermia, because you're losing so much blood and your temperature levels drop. So that can happen even 7 days after delivery, or it could happen there in theater. Okay. Did I answer both questions? Okay. Thank you.
Hello, everyone. I just want to ask, on behalf of we that we are undergoing menopause, is it possible to get, when you start sweating and the sweating, is it possible that you can get dehydrated? Extreme dehydration, that you have dry lips and your mouth is dry. Please, what's the solution?
Okay. I'll briefly talk about perimenopause and menopause, and then I'll be able to answer that. Is that okay? So perimenopause means, I'll just start from the beginning. So every girl is born with the amount of ovaries in their, amount of eggs, in their ovaries. And as the girl gets older, the eggs are released, okay? Again, we're born with an amount. So as we get older as well, our estrogen and our progesterone, which are the sex hormones, starts to decline. Menopause is when a lady has stopped having her period after no period for 12 months, which could happen between the age of 51 to 52. But I think in Nigeria, the average age is in the late 40s. Now, perimenopause is when a lady starts to experience some symptoms of menopause just before she goes into menopause. Again, the reason for this is because the estrogen and the progesterone, which are the sex hormone, and also the testosterone that men do carry as well, starts to get low. So the symptoms, so a woman can be having symptoms of perimenopause and still have her period, okay? The symptoms of perimenopause are her period starts getting irregular, so it can start getting longer or lighter. For example, if a lady used to bleed for like 2-3 days, she might notice that she's bleeding for maybe 5 days and it starts getting heavier. She might notice that she's not bleeding every month. It becomes maybe 2-3 months late. Other symptoms are the hot flashes or the hot flushes everyone knows, or the common symptom most people talk about, where the woman is hot from her head to her chest, even if she's in an air-conditioned room. Another symptom that Mom mentioned here is dry mouth, and the reason for that is the low estrogen levels also in the mouth. So it can cause the dry mouth, dry eyes. It could also cause varicose veins that you see at the back of the legs of most women. Another symptom that most people are not aware about is insomnia. Most people might think it's just stress related, but it's a very common symptom of perimenopause. The symptoms are so long, so I'm just going to keep mentioning them. Anxiety is another one. So you notice that your wife or your auntie is more anxious, she's more agitated. When you tell her something, she's just furious. Forgetfulness is one that is not very common. So you notice that your auntie, your mom, your wife has started saying something in a conversation, but then she's forgotten what she's saying. Another symptom could be headaches. So headaches happen as well. But what I would say to people is that please check your blood pressure, please check the pattern of your headaches, and don't just tie it to perimenopause. Another symptom is low mood. Unfortunately, in this part of the world, it's not something anyone wants to talk about, but low mood is a very common sign of perimenopause and also menopause. Dry vagina is a very big one, and the dry vagina can lead to dry urethra, where your urine comes out from as a woman. that can lead to multiple kidney infections. So you notice most women keep going to their doctor, that they are passing burning or hot urine. The doctor might not be, depending on who they see, it might be a very, very junior doctor, might give them an antibiotics, and then that antibiotics will cause vaginal thrush, which will cause vagina itch, and then you're treated with an anti-thrush medication, and the cycle continues. I've seen ladies who have been on antibiotics back to back for 6 months, only to find out that it was actually perimenopause. Again, these symptoms are similar to the symptoms in menopause, so you also notice joint aches, so you notice your elbows, your joints, your knees, your back, your neck, they are very sore, they are very stiff. The list is so long. So, these things have treatment, and the treatment doesn't have to be hormonal replacement. They could be subtle symptoms like wearing cotton clothes, like make sure your underwears are made of cottons, your underwear, your nightwears are made of cotton. Try to sleep with, if you can afford it, an AC or a fan, or now we have the small fans that you can carry everywhere you go. I will also advise exercise. I know when I say it, everyone is like, I don't want to go to the gym, but you don't have to go to the gym. You saw the way I walked to that lady. I will tell you a secret. My mom had full-blown menopause at 45. So perimenopause is it's a stage you get to in your life before menopause, right? And it takes 7 to 10 years for you to go to menopause. Now women are going into menopause 12 to 14 years earlier. No, sorry, women are going into perimenopause 12 to 14 years earlier. So if you take 45 and you subtract 12 or 14 from it, it just tells you how early most people can go into perimenopause without realizing it. Okay, I'm in my late 30s, so I can go through perimenopause. Yeah. So let me go back to why I shared that story. So that lady wanted to ask a question. I did my exercise. I walked up to her. That was my exercise. I walked back. That was my exercise. I was sitting here. There's another exercise for when the bladder is weak, which happens during perimenopause. It's known as the Kegel exercise, where you squeeze your vagina tight, and it's good for men to know this. The woman squeezes her vagina tight and holds it for 10 seconds and gently relaxes that. So that strengthens the vagina, and that helps with good sex. So that's why I say men should know this as well. Okay. Now, in terms of the dry mouth, dry vagina, for the dry mouth, unfortunately, there is no cure for it, but we can treat the symptoms. So the symptom is drinking water, staying hydrated, chewing on ice, and chewing sugar-free gum to help the tongue produce saliva. Okay? Some people say you can get like the Vicks sweets. The non-sugar-free sweets could also help. In terms of the dry vagina, I beg every woman in the room, please avoid using Vaseline, avoid using olive oil. The reason for that is it attracts dust. So it attracts, when it attracts dust, then it attracts microorganisms like bacteria, and it's fungal infections as well. So it's just to be very careful. There are simple things that we could use, like a water-based lubricant. You can get it from the pharmacist. I don't know how much they sell it, but I think it's less than 1,000 or 2,000 naira for a long tube, the size of a toothpaste. Yes, some people say 3,000 naira, and that could last you for a month or even longer. Another thing is to avoid washing or scrubbing the vagina with soap. So soap is the enemy to every woman, young girl, baby's vagina. Okay, water is enough. Another thing is the probiotic. So the probiotic, you can get it from yogurt, but please not the sweetened yogurt. Don't use the opportunity to eat too much sugar and give yourself diabetes in the name of trying to eat probiotic. Sorry, in the name of trying to eat probiotic yogurt. So it should be unsweetened probiotic that should be used. Now, I want to talk about the mood changes that happens during perimenopause and menopause, because people don't talk about it, they feel it's a taboo. And it's destroying a lot of marriages, it's destroying a lot of relationships for people who are not married. The hormones, the sex hormones are very, very strong. And I kid you not that men go through it as well, because I've seen men in my clinic with low testosterone, and also cases like erectile dysfunction. And unfortunately, because they can't talk about it, because erectile dysfunction is not only caused by testosterone, it's also caused by psychological changes as well. So it could be caused by, so for example, let's think of a family. The man is age 50, the woman is age 48, she's going through menopause, her moods are all over the place. The man is going through his own mood swing, he can't talk to her about it, and now he has developed erectile dysfunction. So erectile dysfunction, for the sake of men that are in the room, is when the penis cannot be erected first thing in the morning, which is normal anatomy, or the man doesn't have any erection during sexual intercourse. So why is this important? Even the Holy Spirit has emotion. When Jesus was on earth, he has emotion. God has emotion. I mean, when we go for worship, I'm a Christian, so I don't really know much about Islamic, but when we go for worship, we sing, we cry, because we have emotions. Emotions are very, very important. I don't want us to take it for granted, okay? So if you feel that your mood has started changing, people have started saying you're more agitated than normal, or you're more moody than normal, or you're not engaging in social activities as before, I would advise you take a step back and see, okay, how long has this been going on? What is my period like if you're a woman? What other symptoms am I having? Not just the mood. Is it my sleep, my joints? You know, is it my work environment? Have I changed my environment? The same goes for men. So I would advise you what has changed in your relationship, what has changed in your line of work. I know the big one in Nigeria could be blood pressure medication. That can affect erectile dysfunction for men, but it's also good to also think about the psychological impact that can cause erectile dysfunction and can also worsen erectile dysfunction. So that's why I want to talk about it today. I know some people might feel a little bit embarrassed, but this is medicine, and God created us from head to toe. And from head to toe matters, not just our genital area. So I'm happy to take more questions, because I don't like talking too much. I prefer talk and answer. Thank you.
Thank you very much. Good afternoon, everyone in the house. I'm very pleased to be here today. I'm most excited. Also, I want to say that Miss Oshisoya happened to be my longtime line manager at Chapel Hill. We worked together, and I honestly can relate. I know her story very well. And I'm honestly happy. I just bumped into this last night in the course of my not sleeping, because everything you have just talked about there is happening to me, except the dryness of mouth and all of that. I've been experiencing everything. You know, at some point I wanted to speak before you started, but I said, okay, let me just hear you talk maybe. And you have just mentioned everything, so there's no point for me to ask too many questions. But in the course of this, my question is, my own, when people, like everybody in this room now, the AC is on, right? Thankfully, I'm not sweating right now. When people are hot, I am shivering. When people are shivering, I am hot. And then in the office, you see me, it's raining. People, everywhere is cold. Everybody's shaking. And it's at that point, I want the AC to be at its, you understand? So that happens to me. And I'm coming out from the bathroom. I just had my bath. I'm coming out from the bathroom like, I've not even finished cleaning my body. I'm sweating. Like all of this is happening to me. And what else? I think the sexual aspect too. The, I don't even want to even be touched at some point, you know, and all of that is happening to me. What else I'm trying to remember? Then sleep. For the first time in like all my life, I'm 43. I just checked my blood pressure. It's at 140. It's the first time in my entire life that I'm seeing 140. It's always been 120, 123, and all of that. So I didn't need a soothsayer to tell me I don't sleep. I bump into this program last night, and because of my scroll, I would just be on the phone looking for what is not lost, and 2 a.m. I'm not sleeping yet. And then I'm going to work. By 5, I should be up. I ought to be dressed for work, and by 6, I should leave the house because work is 6:45, and then, for golf has to tee off at 7 o'clock. So I'm already in the office, and I come back again. Well, I don't work all the time. I work Monday to Sunday, but I have all the time in the world because there are times I could just work two times in a week. Maybe I'm working on Monday and I'm working again on Thursday, and the rest of the week I'm free. I don't sleep. I'll just be looking for what is not lost. I can just carry my bag. I don't even rest. Going from Nigeria to Kafancha, looking for what is not lost. What can I do? Thank you.
So there are so many things you can do. Come to Eta Atlantic Memorial Hospital in Ikate, if it's not too far from you. But in terms of sleep, yes, the insomnia, the poor sleep is a very huge symptom with perimenopause and menopause. There are a few things that you can take. Magnesium supplements, which you could get it over the counter, is very good. It's best taken 2 hours before you sleep. Another thing I advise people is that let your bedroom be your bedroom for sleep or for sex. So it shouldn't be where you're walking or you're using your phone or trying to finish up your daily activity. So the bedroom, before you go into it, the light should be switched off. And if you start doing it every night, it becomes a habit, and it helps. So switch off the light, let it be a dark room, and let it be well ventilated and curtain nightwears. Another thing that you could try is the relaxing teas. So when I mean relaxing teas, no agbo. Agbo is not what I would recommend. I would recommend things like chamomile tea. To be taken at least 4 hours before. If you take it too soon before bed, you're going to wake up urinating a lot. So it's to try to find that balance. Try and set a sleep calendar app. That's why I call it. So you have an alarm that you wake up every morning at 5, but you go to bed every night at 8. Now, I know in Nigeria it's not feasible because of our work life. Bedtime is 10, 11. But we're trying to train the body to have a good sleeping routine. So the only way we can do that is by being consistent with the sleep cycle. So if you tell yourself, I have, like my phone goes gray at 9 p.m. and it goes into DND. So if you are calling me at 9, I won't see it, it wouldn't ring, except I'm holding my phone. So I love to go on LinkedIn and Instagram for work, but once it goes gray, I'm like, what's the point? There's no color, so there's no point using the phone. But magnesium will really, really help your symptoms. There are a few things that could help, but it's not a consultation today, and I don't want to be throwing medication like Professor Gynaecological said. I would say speak to okay, yes. You can come see me in Eta Atlantic Memorial Hospital, or you could go through Lady O, my gynae. She will recommend other doctors that are close by that have passion in perimenopause or menopause. Any other question? Okay. I'm doing my exercise now. I will talk about diet too, and vitamins you can take.
Yeah. Thank you. I actually want to thank Rotarian Oyekon for creating this platform for women. You're so beautiful. I have a beautiful heart. Thank you so much. God bless you. Like, a lot of us have a lot of things in our mind that and now we are throwing it out. God bless you. So my question is, I'm in my 40s. Life happens. So for some time, I'm away for, okay, let me say, I was away from being intimate with, and so 2024, there was a kind of program organized by Rotary in my area there. So there's something they call a pelvic kiniko. So when I heard that, the nurse that attended to me she said, "You're closing up." She said, "Why?" I said, "I don't know that life and all that." She said, "I should try and lose all that." Okay. So 2025, I checked again, relationship, let me try. And twice, it's so like I went for Ishebiri, like all my body from my head to my toes. So they use armor on me. So I ran away. I was like, oh, maybe this one is not, like it was hard for me, I'm not a doctor, so I use my own layman, that okay, maybe we are not compatible, maybe there's no alignment and all that. So, but I'm still thinking, I'm still young, and I'm like, it wasn't like this before, totally alone. Now it's like this. Is it medical? Is it because I've abstained for some years? Because I was away for many years, I didn't even go there. So what could be wrong? So when she now mentioned that she's 43, I'm like, Abi.
Yes. I love the way she handed the mic to me. I'm not 43 yet, but thank you. Yes, perimenopause can, because of the low estrogen and the low progesterone, it makes the vagina dry. So I think that is why the nurse was saying you're closing up, because the vagina gets really dry. Again, having regular sexual intercourse lubricates the vagina, but once a woman has low estrogen and low progesterone, the blood vessels to the vagina is less, and the vagina anatomy is not as elastic. But yes, you can still enjoy good sex, and that is where we recommend using water-based lubricants to lubricate the vagina. Again, I will advise that you see a women's health physiotherapist or a women's health specialist that can advise you on how to do this safely without hurting yourself. I hope that helps. Any question? Any question? No. Okay. I didn't touch on vitamins and supplements that we can take if we're going through perimenopause. So again, you don't have to wait to go through perimenopause before taking them. I would recommend, because of time, normally if a lady or anyone in this room from 18 years plus, there are screenings that should be done. I'm a big fan of screening. So there are screenings that should be done, things like getting your blood pressure checked, things like getting your period symptoms checked. So it's not because you're having your period every month and you're having period pain that you feel is normal. And that is why, things like fibroid or PCOS are being missed early. So if you notice, if you're a very young girl in this room, I know I've been talking about women in their 40s and 50s, but if you're a very young girl, you have started your period in the last 4 or 5 years and you notice that it's changing, it's heavier, it's painful, or it's irregular, or you feel you are bleeding maybe every 10 or 14 days, that is not normal. My advice is to please see a gynecologist to get that sorted, okay? Another blood test that you should be having for any young girl that is having her period should be a full blood count and an iron levels checked as well. So if you're between 21 and above, January is the month for cervical awareness. So I would advise you to please get your pap smear done. Again, I know people argue, should you be doing it on virgins? So people who haven't had their hymen broken through sexual intercourse. Yes, the doctor can still perform cervical. The doctor can still perform a safe pap smear. The hymen is a thin elastic organ that is in the vagina. It has a hole and it can be elastic. It can be stretched, because it's an elastic tissue. So the brush can gently be put in to take samples to make sure that there are no signs of human papilloma virus, which is the virus that causes cervical cancer. So please, for women who have daughters in the room that are 21 and above, I know in Nigeria the screening age is 21. In Republic of Ireland, where I came from, the screening age is 25, and it continues up to 65. So please, if you are 60, 61, 62, 63, 64, and 65, do not say you don't need to have the pap smear done. It's very important. Early detection saves life. We keep saying we know it, but we wait for our body to have symptoms before we get checked. So don't wait for your bodies to have symptoms. For men that are 21 and above, I advise you to get your blood pressure checked. I advise you to also get your blood sugar checked because it's very important, and diabetes is very rampant in this part of the world that we live in. For women and men 30 years and above, again, the cervical pap smear. For women, the breast exam should be done every month. It should be done 10 days after your period. For girls, you should check the breast yourself, make sure nothing has changed, stand in front of a mirror. If it's something you can't do yourself, look for a nurse or a female gynecologist if you're comfortable, or a male gynecologist. I just want you to look for someone that is a medical personnel that can walk you through and educate you on how to do a self-breast exam so that you can teach other young girls out there. For men, again, blood pressure check, blood sugar check, full blood count. You want to check your kidneys. You also want to check for diabetes, which is a blood test that can be done as well. So for men and women, 40s and above. So for women, the pap smear is important. Then you go from self-breast check to the mammogram, which is the ultrasound scan. In Nigeria, it's done 40 years and above. It's done every year to every 2 years. But if there's a high risk of breast cancer, then it's done more regularly. Again, you want to check your full blood count, your iron levels, your diabetes screen, your thyroid screen. And for men, the same blood test, but you're adding your PSA, which is the prostate blood test to check for prostate cancer, and also to have a prostate exam checked with your doctor. And for people 50 and above, again, I would advise you to get screening done every 6 months to 12 months. And the lady who spoke about her body's temperature being different in different environments, I would advise you to also check your thyroid level, because the thyroid hormone or the thyroid gland plays a big factor on our temperature, and most times it's mistaken to just sexual hormonal fluctuation, not just the thyroid hormones. So it's something to just write down if you're going to see your doctor to get your thyroid levels checked. Thank you. Sorry, I rushed this. I'm running.
Thank you very much, Dr. Rama. Oh my gosh, she is packed with information, right? So please, for anybody who could not write all the checklist of things that she said fast enough, please go back and look for my Gynae Issues Foundation recording of this summit online. I'm sure we'll give you information about how you can access that. It is very important, of course, that we do all the things that she has spelled out. So I know she could have been here talking to you and answering questions. I know she loves that for hours, but we just had to call it a wrap. So I don't know whether would you still have time? Oh, she has to run. Okay, but yes, please, if you have any questions, do let Madam Oyinkon know, and she will, give Dr. Rama the questions to answer for you. So, thank you. And now, we have the honor of welcoming Adaize, gosh, look how I'm spelling your name. Onuabuchi is a passionate clinical nutritionist and public health facilitator dedicated to helping individuals, organizations, and communities achieve better health through evidence-based nutrition and wellness strategies. She's not a quack. She is the founder of Nourish Nutrition, that is spelled Noureesh, Nutrition, a dynamic wellness brand that offers expert services in clinical nutrition, corporate wellness, and community public health nutrition. At Nourish Nutrition, they provide personalized dietary counseling and meal plans for managing chronic conditions such as diabetes, hypertension, obesity, and gastrointestinal disorders. Their corporate wellness programs are designed to improve employee health and productivity through interactive nutrition workshops, tailored meal planning, and stress management support. They are also deeply committed to public health advocacy, delivering impactful nutrition education programs in rural communities, schools, and underserved populations across Nigeria. So we would just like to welcome now to speak on the topic of nutrition and lifestyle, including in fibroid management. She'll speak about practical, affordable food guidance, and she'll help to bust some myths that you have. Also speaking on the topic of lifestyle shifts that support hormonal health. So she can say it much better herself. I'd like to welcome Dr. Is it? Dietitian Adaeze.
Good afternoon, everybody. Good afternoon. My name is Adaeze Onwabuchi, and I'm very excited to be here. First of all, I want to express my gratitude to my GYNAE Foundation, especially the founder, Lady Oyinkon, and also Sister Bola, and every other member of this beautiful foundation. I'm not just expressing my gratitude because of the opportunity and the privilege to be here to impact other women. I'm expressing my gratitude because 8 weeks ago, I would have been dead. Yes, that's the truth. So today, I'm not just standing here as a clinical dietitian, I'm standing here as a woman that is currently in post-op that has survived fibroids. So I lived with fibroids, and today, I am free of fibroids. So a round of applause for my GYNAE Foundation. Okay, so 8 weeks ago, I had an open myomectomy surgery. Mike, please cooperate with me. I had an open myomectomy surgery, and I'm super excited and grateful to be here today to impact lives. Yeah, so as a dietitian, I spent years educating women. It's been over 8 years of me consulting. And I've been educating women about their hormones, nutrition, lifestyle, everything. But nobody knew that 3 years ago, I started battling fibroids. So while I'll come on live sessions, I'll be in the clinic, I'll be consulting, talking to people, nobody knew that I had an 8 kg mass of pedunculated subserosal fibroids. So let me break down that English. So my own kind of fibroid was not the one in the uterus. No, it was the one outside the uterus. And I'm lucky today that they didn't even give me an L cut. Even though my cut is very long, they were supposed to give me a cut here and here. Because my surgeon told me that the fibroid that was brought out, it was already growing towards my heart. So it was a very bad one. So while other women were battling fibroids that led to bleeding, excessive bleeding, I was battling every day with bloating, pains, indigestion, different kind of issues. So everybody will eat and be fine. I will eat even the smallest food, and I'll be struggling to breathe. And even with that, I still turned up for my patients. Nobody knew what was going on. But God came through for me. So I want you to understand that it's not just about the knowledge of what is fibroids. I teach women how to, shrink their fibroids. I teach women how to not have their fibroids grow back again. But then I'll go back behind the scenes and I'm asking myself, what exactly is going on with me? I know what to eat. I eat the right foods. I eat healthy. I live healthy. So it's not just about your food. Fibroid is not just hormonal. Fibroid is psychological. Fibroid is metabolic. Fibroid is emotional. And I want you to understand that today. And that is why this story, this seminar is very, very personal to me. Because I need you to understand that fibroid is not just that benign tumor or the muscle tumors that grow in your uterus. Fibroid is beyond the uterus. And in my own case, it was not about the diet, it was not about the lifestyle, it was about something more than that. It was about balance. And when I talk about balance, that's why I said fibroid is also psychological and emotional. So stay with me today. If you need to pull out your biros and your papers, please pull it out because I came fully ready for everybody. Okay, so let's talk about why fibroid is even more prevalent in African women. A lot of my patients will ask me, oh, dietitian, why is it that, our white counterparts, they don't experience these things? First and foremost, as an African woman, our dark skin, it does not produce more vitamin D when we are exposed to sunlight, which is the most common source of vitamin D. So most African women, they have vitamin D deficiency. That is on a standard. Number two, as African women, we have a higher level of progesterone and estrogen in our bodies. That's number two. Number three, it's not like generally all women don't have fibroids, but in African women, our own fibroid cells, they have more estrogen receptors. What do I mean by that? The fibroids in our bodies, they have more estrogen. They react more to estrogen compared to other counterparts. That's why you see a lot of people, they say, oh, it grows in our family. It's not just a family thing. Some people, they don't even have fibroid in their family, but maybe because of the lifestyle. So what happens is that genetically as African women, we're already predisposed to fibroids. Now, our environment, our skin, and some other factors now make it to begin to do what? To begin to grow rapidly. And that is why most African women, they are more genetically predisposed to fibroids. It's as simple as that. That's it. So now I'm going to be breaking down the role of nutrition, the role of your metabolic health, and the role of your hormone in fibroids and in fibroid management. So let's look at the first one. Why is nutrition very important in fibroid management? And that's why I'm here today. Okay? So first things first is, let's look at the role of your guts. I always tell people that there are two major systems that play a major role in fibroid management: your gut health and your liver health. Those are the two most important systems you should watch out for in your body. Now, your gut health starts from your mouth down to your intestines. Okay? So whenever they're saying gut health, your gut health is connected to everything in your body, especially your hormones. And you know that as women, our bodies are driven by our hormones. Yes or no? Good. So first thing, if your gut health is not right, it is going to affect the presence of what? Estrogen and the metabolism of estrogen in your body. Remember that the two major hormones we have in our body is the estrogen and the progesterone. Now, when there is a dominance of estrogen in your body, what happens? Different hormonal issues start to come up, especially fibroids. Now, what is the major system that breaks down the estrogen hormone in your body? It's the liver. Now, when there's an excess of estrogen in your body and your gut health is not right, what happens is that instead of that excess estrogen to be removed by the liver, to be detoxified, it will go back into the system and be reabsorbed in the system. So the liver is not detoxifying the excess estrogen. The liver will leave it there. So the excess estrogen in your body will be causing you different issues. So it's as simple as that. So your gut health has to be right to be able to help your liver. In my own case, when they were checking me, when I was diagnosed with fibroids and all that, they started watching my liver. They told me, your liver is beginning to have issues. I said, my liver have issues. Then I started going into deep research. That was how I discovered that if my gut health is not right, my liver cannot be right. And aside from my gut health, fine, my gut health was right, everything was right, but if the body that is carrying both the gut and the liver is not in the right state, forget it. And in my own case, it was trauma. It was emotional trauma that was feeding my fibroids. If you can relate to emotional trauma, please raise up your hands. Thank you very much. Please, this is a no judgment zone. It's a place for us to learn and help each other and impact each other. As women, we go through a lot. A lot. From growing as a child to teenager to puberty to everything to womanhood, there's a lot that women go through. So today I need you to understand the psychological aspect of fibroids, okay? Now let's look into nutrition generally in controlling fibroids. And that's why I came with everything. The first thing first in managing fibroids starts from your nutrition. I'm going to be showing you herbs, I'm going to be showing you supplements and everything that you need. Okay? So I'm talking about those that have small fibroids and they want to shrink it, and those that have fibroids that have already grown, and then those that have already done surgery and they want to prevent the regrowth of the fibroids. So please stay with me. First things first is you need to watch your fiber intake. So when I talk about fiber, I mean the whole grains. When I started managing my fibroids, okay, I turned from eating my white rice, normal white rice, into brown rice. I don't mean ofada rice. Brown rice. Because a lot of my patients say, oh, dietitian, that brown rice, sorry, that's ofada rice, it smells somehow. No, that's not ofada rice. What I was eating was brown rice. You can get it in the market. Okay? Brown rice is filled with a lot of whole fiber, rich fiber. I also give it to my diabetic patients. Why? Because it's complex. Of everything of the fiber.
Okay. Once again, just a video of technical issues.
Okay, so if you are with me, say hello. Thank you very much for that. Okay, so let's continue. So I was talking about fiber. Fiber is very important. Now, when we talk about fiber, we start from our most common staple food in Nigeria, which is our rice. Everybody loves rice. Patients, when I'm taking a 24-hour diet record, they'll tell me, oh, dietitian, I love at night. Understand? We all love rice. But the kind of rice that you eat that now matters. I will not tell you to go and eat basmati rice. I won't do that. That are very, very good in fiber. Sweet potato is very good. Sweet potato is Irish potato. I tell my patients any day, anytime. I even give it to my diabetic patients too. Sweet potato is better. It's high in fiber. Traces of protein in better. But please, if you have fibroids, yam. I, for one, yam is my best food. Please avoid yams if you have fibroids. How would I be avoiding my pounded yam? Everything. Please avoid it. Then another thing is, first, say you don't like your beans. Beans is very good. It's very high in fiber too. Beans is very, very good. I had to incorporate that into my diet. Then we're very lucky that in Nigeria we have a lot of vegetables. Our vegetables are our major source of fiber. We can mention different soups that we have our vegetables in it. People, if you are from the east, say Ndewo. Somebody that is very European, if I don't calf, they say Ndewo. Okay, so people from the east, even people in Lagos, you eat Igbo soups too. You have your oha soup, you have your bitter leaf soup, you have your afang soup, you have your vegetable soup, okra soup. Soups you can take that are very rich in vegetables. But please, if you have fibroid, try to cut down your egusi intake. Your egusi intake, please try to cut it down. Like, in fact, if possible, just remove it from your diet. There are other soups you can use to replace it. Yes. Because egusi is very high in fat. And guess what? Those are the things that fight very well. So you need to avoid them. The rich vegetable soups, they are better for you in fibroids. And they help you to prevent the regrowth. Now let's look at major nutrients and supplements that you need to manage fibroids. Now I always tell my patients, the first one is vitamin. Because as African women, our dark skin cannot be able to produce vitamin C in the presence of sunlight. But now, just taking vitamin D alone or getting vitamin D from your food is not just enough. That is why I came with the things that you need. I'm telling you to go and buy this, though. I'm just showing you so that you know, because I don't like to gatekeep anything. I like to show you so that when you go to your pharmacy store or when you go to your nearest chemist, you know what to ask for. Exact thing to ask for. Now, when you want to take your vitamin D, make sure you're not just getting any kind of vitamin D. Make sure you're getting vitamin D. And the one, if you can get the one that has and K2, very, very important. D plus K2. D3 plus K2. Don't go and get vitamin D, whatever. No. Vitamin D3 plus K2. If you can get just vitamin D3 and then you get vitamin K2, beautiful. But if you can get a combination supplement like this, it is very, very okay. So for we have small fibroids, this will go a long way for you. Gone through surgery and you don't want a regrowth again, this is the best for you. Because most women, we have what? Vitamin D3 deficiency. Let me come to the back. Vitamin D plus K2. Can we all hear me? Those at the back. Good. You can get any brand, but this is one brand, okay? You can get any brand of vitamin D3 plus what? K2. But make sure that when you are taking it, it is supervised. You are taking the right dosage. Make sure it's being supervised by your doctor. Although when you go, even on the can, they will show the dosage for you to take there. Okay? Please don't go and overindulge or don't go and do it without the supervision of your doctor. That is number one. Now, you can get it from your food too. From your egg yolk, you can get it from your seeds, like your pumpkin seeds, your flax seeds, your almonds, your almond nuts. You can get it from there too, but they are not readily available from your diet. That is why we advise supplementation. You are taking your vitamin D3 plus K2. Make sure you don't take it empty. Please, you don't take water. Women that go through fibroids suffer a lot. Suffer that is bleeding, iron. They're always very anemic. Mine was not growing in the uterus. That's why I was lucky enough not to experience bleeding. But I was going through on a basis. Every day, when you eat normally and your food is digesting, mine does not digest. I go through respiratory issues. I was going through different kind of pain. Digestive organs against my liver. So it's really bad. So if women experience excessive bleeding, and this leads to what? Iron deficiency. And it leads them to become why you notice that you become anybody else up your experience and what can you do to help for that? I don't go and get iron supplements. No. Because most of the time supplements, most of the ones that we have common in Nigeria, they are not good. So what do I advise them to do? I advise them to use their what? Of iron and also the animal source of iron, and make sure there's a presence of vitamin C there. Now, how do we? Let's do common ones. We all know that we have a lot of ugu. If you know ugu, raise up your hands. If you know this vegetable called tufa, raise up your hands. Good. Hospital tufa, you can find it around. It grows really. Tufa, ugu, and your hands. In fact, it's highest in the content of iron. Iron. It has the highest iron content to plants. How do you now take these leaves? Now, when you rinse them with your salt water to remove any kind of germs or anything, then you put into your blender, blend it, then natural orange juice, lime or your lemon juice into it. So why your lemon or your lime or your orange into it? Because of the presence of vitamin C. Vitamin C, it will go and your absorption of the iron. You take it alone, it's not as if you not get the iron, no. But if you are taking it alone, if the iron inside that vegetable juice is 100%, you might be getting just maybe 40 or 50%. But when you add the presence of vitamin C source into it, then your body will be getting the 100% iron that is vegetable juice. It's as simple as that. You even notice that your skin will be clearer. You will notice that your blood, it will boost your blood, your iron sources in your body. Then let's go to the animal sources of iron. We have your beef liver. Beef liver is very, very good for you. Lean beef, but beef liver is better. When you are eating meat, make sure you are taking what in moderation. Moderation is. Some of my patients will say, "Oh, we should be eating organ meat." I went to go and buy this, that. Mentioned beef liver. Okay, now let's look at another one. Is another supplement also managing fibroids is your indotrecabinol. Indotrecabinol, your natural source. The natural sources broccoli and cabbage. Flour, raise up. When you, it looks like fibroid tumors. Yes, someone is laughing. It's true. That's plant medicine. If you know broccoli, raise up your hands. If you know cabbage, raise up your hands. Good. Those are the plant sources of indotrecabinol. But for people that cannot be taking those things, because some people tell me, I go to the market and cauliflower, just a bunch of cauliflower is about 4,000, 5,000. Of broccoli, about 6,000 naira. How can I be eating it? Blah blah blah, and they are not even tasting nice. I'll say get your indotrecabinol if you can afford it, because all those extracts that are inside your indotrecabinol, this should be your best friend. If the fibroids grow again, or if you want to shrink out the small fibroids, if you want to manage it and for it to go forever, you want to ask a question. No, you might not get this brand, but this is indotrecabinol. You can check it. Cabinol, yes. Okay, you want to ask a question? Because vitamin C helps in the absorption of iron. Okay, so let's continue. So I've mentioned which one? I've mentioned the iron. I've mentioned vitamin D3 plus K2, and I've mentioned indotrecabinol that I can get from your cabbage, your cauliflower, and your. Okay. Now let's look at another one that is very, very important. I always tell people about EGCG, green tea extract. In fact, this one is a game changer. Many people that getting green tea extract from the grocery stores or supermarkets, those things are not green tea. Green tea extract. This is the real green tea extract. It might not be this brand, but any other brand, go online for EGCG. It is very, very important. Now, what does this do? Excess estrogen is metabolized in the what? In the liver. It helps for detoxification of those excess estrogen from your body. And if your body has high levels of stress hormones, it will help to bring it down, because high level of stress hormones actually leads to increase in what? Estrogen dominance. And estrogen dominance is what causes what? Fibroids to thrive. Please, if you're not understanding what I'm saying, let me know. Are we learning? Are we learning? I will take it again because I want everybody to understand it. Now, this is EGCG, okay? The extract. It has a lot of catechins. It has a lot of... Oh, sorry. Thank you.
One, two. I think...
So this one, the green tea extract, actually helps the liver to detoxify excess estrogen. When your body has an excess of estrogen, that's what leads to what? That's what makes fibroid to thrive in your body. But green tea extract will help to bring it down. And the compound that is inside that green tea extract is the EGCG. So that is what you actually need. If you don't want it to regrow back, or small fibroids that to shrink out. So this actually helped me for the first 2 years that I had fibroid. I was keeping it really little. It was 2 cm. I was pushing it like that, like that, like that. But the fibroids were growing. They were growing. Why? Because the body that was carrying the fibroids was going through a lot of what? Trauma. So trauma messes you up. Okay? That's my phone. Excuse me, everybody. Sorry, I think that's an alarm. It will go down. Okay, so let's continue. So we've talked about EGCG. We've talked about the other ones. Now, that nervous dysregulation, that also causes fibroids to thrive in your body. When we talk about nervous dysregulation, if you're a woman here and you've had an issue whereby maybe if you, I don't want to call the medical name yet, somebody, or if you get a phone call, you will start having anxiety. Raise up your hands. she's raising her 2 hands. If you've ever experienced anxiety disorders, raise up your hands. Maybe if you see somebody all of a sudden, you feel this thing that will go from your throat into your stomach. Raise up your hands. Or if you're somebody that when you get angry, you feel the emotions in your stomach. Raise up your hands. Good. That's nervous dysregulation. In medical terms, we call it PTSD. When it is complex, we call it CPTSD. It can happen as a result of different things. It can be work pressure, it can be family pressure, it can be relationship issues, it can be they gave you breakfast, different kind of things. It can be the death of a loved one. It can be in your office, they don't want to give you, they don't give to your enemy. Yes. Yes, or maybe you went to a prophet and they told you the person that is behind your issues is that man at the back. Anytime you see him, you start. Yes. That's nervous dysregulation. Now, another thing is that nervous dysregulation affects fibroids. It makes fibroids to grow, yes. In fact, it used to feed fibroids. So fibroid is beyond gynecology. It's beyond your uterus. It goes a long way. So the body now uses the fibroid as a shock absorber. So when that shock comes to your body, the fibroid will take it in. So you can see that God, the way God made our body, there's a lot of intelligence going on. The fibroid is also protecting your body. Because if your body should take in that shock, some of you will get that shock. Maybe you see that man that prophet said is the one behind your problem. You will just faint and die. But the fibroid will take in that shock. Guess what? The fibroid will continue to grow even when you eat the right foods. So that is why everything about fibroid has to do with your balance, your hormone, your gynecology, your psychology. It's very important. Now, what does this do for you? This is magnesium glycinate. It's also good for women that are in their menopausal ages. Okay? So, for your nervous dysregulation, this helps to calm your nerves down. Don't get magnesium bitrate or whatever, or citrate or whatever. Get magnesium glycinate. Can everybody see it? Magnesium glycinate. So when you go to the pharmacy, tell them you are looking for magnesium glycinate. Glycinate, yes. It goes a long way to help your what? Nervous dysregulation. And somebody that is used to a lot of stress, your cortisol hormone is always on the rise. This will help to bring it down. So these are the supplements and the vitamins that can actually help you to be able to manage your fibroids. For those that have small fibroids, it will help to shrink it out. If you continue being consistent with it. For those that have had surgeries, it will help you not to regrow again. Okay? Now let's look at the foods you need to avoid. But before we go into food you need to avoid, let me talk about herbs for fibroids. And I came prepared. Yes. Pass it round so that they can see. This is black pepper. This is flaxseed. Pass it around so they can see. This is moringa seed.
is ginger. This is turmeric. And this is garlic. Please pass it round, then I'll explain. That's moringa seed. Please pass it so that everybody will see it. So I'm going to be explaining the work of these herbs in the body to be able to manage fibroids, to prevent regrowth, and to shrink the small ones too. Please pass so that everybody will learn. Don't worry. Which one? Glycinate, yes. Okay. So while they're passing it, let me quickly explain because of our time. So one thing that makes fibroid to grow in the body is inflammation. Okay? When inflammation is high in the body, it will make fibroids to what? To grow very, very speedy in the body. Please just pass. Thank you. Now the first thing first is to include an anti-inflammation diet. Anti-inflammatory foods into your what? Everyday eating. Let's start with the anti-inflammatory foods that we have in our kitchen. We've already passed ginger, we've passed turmeric. Ginger, turmeric, and black pepper, they are very, very good anti-inflammatory spices that you can include in your everyday diet. Now, why did I put in black pepper? Please, everybody, pay attention. Pay attention, please. If you finish passing, please bring it back. Thank you. Thank you very much. Okay. Thank you so much. Okay. So these are the top 3 anti-inflammatory agents that we have. Among these top 3, these 2 are the most important ones, turmeric and black pepper. Turmeric and black pepper. In the market, Yorubas call it the atale. Is it atale they call it? Atare. Okay. Atare. Sorry, I'm Igbo. Okay, so why do I always tell my patients to combine turmeric and black pepper? Turmeric on its own has a compound called curcumin. Curcumin is the anti-inflammatory compound in what? In turmeric. Good. But it cannot just work on its own. It's not as if you take turmeric on its own, it will not work on your inflammations and all that. But you see this black pepper, there's a compound in it called pepperine that when you combine it with the curcumin in turmeric, it will make it to work like 1000x. Yes. When you combine turmeric and black pepper, there is no inflammation. Even I use it for my patients that have arthritis. There is no inflammation that is in your body that it will not start bringing it down. It works like magic. Yes, I will explain it. So you can add it to your smoothies, you can add it to your soups, your stews. You can decide to blend garlic, ginger, turmeric, and black pepper, and you put it in your honey, and you take it 1 tablespoon morning, 1 tablespoon at night. You will see that pain, that inflammation, that fibroid, go again and go and check. You see that the small ones will start going down. You see that the symptoms will start going down. It's as simple as that. I'm not here today to gatekeep anything. You can also use it for your teas too. It's very, very important. But make sure that when you are using your turmeric, you are using it with your black pepper. So you can combine ginger, turmeric, and black pepper. But please, if you have ulcer, don't take these 3. Because it's highly spicy. Okay? Good. If you are learning something, say hello. Great. Thank you very much. Now, okay.
Normally, when I make my stew, I use turmeric, ginger, and garlic. So can I add that black pepper to blend the pepper and tomatoes too?
You can add it. Okay, I have a question.
To buttress that, I just want to say that I'm pleased right now because there is nothing I make. Soup, well, I don't do Indomie that much. Soup, anything I do that I don't add these items that you have mentioned, except the black pepper. So I'm surprised now, and in fact, thank you for bringing it to my notice.
You're welcome. Okay, so let's continue. So I have here with me, let's talk about flaxseed. I have garlic. I know a lot of you say, I don't like garlic. I'll be smelling like Chinese. I'll be smelling like Indian person, blah, blah, blah. But you see, this garlic is one of the greatest wonders in the world. I'm telling you the way it is. Remember that estrogen is found in your liver, right? Good. And it's your liver that breaks down estrogen. And it's when you have excess estrogen in your body. That is when all those things like fibroids, hormonal issues, PCOS and God, they will start coming up, right? How do you help your liver to detoxify? Please add your garlic. Add your garlic to your diet. In fact, when I was younger, I used to look at my dad like, sometimes my dad would be chewing on raw garlic. I'd be like, this man. But the truth of the matter is that growing up and then becoming a clinical dietitian, I discovered that this is one of the greatest wonders of the world. If I start telling you about garlic, we will not live here today. The major compound in garlic that helps for detoxification and also all those antibacterial and antiviral is allicin in garlic. So garlic is very important. Some of you might say, oh, I'll prefer to take garlic pills. But my dear, garlic, you can use it to marinate your meat. If you don't want to start chewing it, not just raw like that, you can use it in your meat. You can use it in your smoothies. You can use it in your hibiscus tea. That's your zobo. It's very, very good. It's very good for women. And for women that have a history of candidiasis, vaginitis, inflammation in the vagina and things like that, all those small infections, when you have garlic in your diet, it will prevent it. And it helps to boost your immune system. So garlic is very, very good. Okay? Now, seeds like flaxseed. Flaxseed is very, very good. If I start telling you about flaxseed, it's not only for women, even for men too. The men that come to my clinic, people that have erectile dysfunction issues, people that have low sperm counts, low sperm quality, I always put this in their nutrition therapy. Flaxseed is very good. Women in menopause, flaxseed is very good for them, especially those that experience frigidity or dry vagina. It is very good for you. It's very, very good. Then it's a very high source of zinc in the body. So you need it. Flax seeds help you a lot. So please incorporate it into your diet, okay? Now let's go to moringa. Moringa is also very good. Remember I told you that the leaves are very high in iron. And the seeds are also very high in iron. But the seeds are higher in calcium than iron. So you need all these things in your body. They are very, very good for you. There are other herbs too, but because I couldn't get them here, I couldn't bring them. But if you can get milk thistle, dandelion roots, chestberry, they are very, very good for fibroids. But please, I want to warn you about something. When you are taking these things, make sure that you are taking it under the supervision of a nutritionist, dietitian, or a naturopathic doctor. Don't just go and take it and say, I don't know the dosage, but it's like this one, maybe because they say my fibroid is big, let me take like 10 cans. No. Please, I'm begging you, do not do that. Make sure you are taking it under what supervision. Okay? So that's basically about that. Now let's look into the lifestyle. How does your lifestyle affect your fibroids? How will you incorporate the right lifestyle habits that will help you to be able to, manage your fibroids, shrink it out, or avoid it from regrowing again? First things first is what is called your circadian rhythm. What is that? Your sleep. You see, this sleep is very important. If your body is not getting between 6 to 8 hours of sleep, you are not doing your body anyway, especially as a woman. There's a lot going on in our bodies. We are going through a lot of pressure. Workplace pressure, family pressure, society pressure, everything is on us. We have a lot of body we are carrying. We manage a lot of things. We try to put a lot of things together from falling apart. So there's already a lot of stress, mental stress, emotional stress going on. The only thing you can do for your body in self-care is to give your body the right rest. Some of you go to bed by 12, 1 o'clock. You are waking up by 4, 5. How many hours of sleep? And if you keep doing this over and over again, guess what you are doing in your body? You are building up the stress hormones in your body. And when your stress hormones are building up, let me tell you what it will do to you. First things first is that it will start affecting your hormones, start having hormonal imbalance. Secondly, your fat stores will start increasing. So no matter, even if you go and become a shareholder in iFitness gym, that fat will not leave your body. Yes, it will not leave your body. If you like jog from here to Yanokbaja, that fat will remain in that your body because the stress hormones are very high and it is gingering the fat hormones. Now, when the fat stores are very high, guess what? Your fibroid, they are feeding them. You're just giving them biscuit to eat. That's the truth. So they are all interconnected. So please make sure you're getting enough sleep. Now another thing is, we've already talked about your diet. Make sure that in your diet, all of you that like all those processed foods, biscuits, small chops, chin chin, this and that, shawarma, please cut down. So when I go out and my friends are like, oh, you don't drink carbonated drinks. I guess it's because you're a dietitian. I say no. Because when I drink those things, even if I drink it once in a while, it will go and be boosting those words, the fibroids. It feeds them. Alcohol is even one major thing that feeds fibroids. If you've been diagnosed with fibroids, don't say, I only take alcohol during weddings on Saturday, or I only take alcohol with my friends. No, cut it off. There's no religious anything about it, just cut it off. If you want that fibroid to go, or if you've gone through a surgery and you don't want it to come back, cut alcohol off. Yes, if I start breaking down the science between alcohol and fibroid growth, we will not go home today. Just cut it off. Then your canned food, your processed food have preservatives. They are not good for your body. If you want to manage fibroids, if you don't want it to come back, you want to shut it out, avoid those ultra-processed canned foods and whatever, because the kind of chemical compounds they put in them is not good for your body. It causes hormonal imbalance. I practically had to switch from my relaxed hair to start growing my natural hair. Because most of our relaxers, they cause hormonal imbalance for us. And they affect the growth of fibroids. They increase it, they speed it up. So even some of you that say, oh, I'm only rubbing organic cream, organic skincare. Most of the organic, if we tell you what is inside the organic, you would prefer to go and be buying your Vaseline outside, or Ori, or palm kernel oil. Because most of those organic are worse than the Caro White bleaching cream. Yes. And these are the things that will go into your bloodstream through your skin, and it's going to be messing your body up. But the truth is, let me tell you something you don't understand. As women, our bodies, even though it's complex, is so beautiful. And it heals itself most of the time. That's one grace we have. If you start eating the right foods, incorporating your fruits and vegetables, the right herbs and everything, it will show in your skin naturally. And you're avoiding stress, it will show in your skin. Your skin will be healthy. I tell most people that your outer skin is as a result of what you put inside your mouth. Whether you like it or yes. So these are the things you need to watch. These are the things you need to watch out for. Don't be like this, my fine brown skin sister, and you say you want to be like Madame Onyinko in 2 weeks' time. You are killing yourself. So most of these creams, most of these things we use on our skin is what is causing us issues in our bodies. Because as women, our body is hormone-driven. And most of those chemical things we use, there are some artificial hormones they put inside it that actually interact with the hormones in our body and messes it up. That's the truth. So these are the things you need to watch out for. Okay? So at this point, I've said a whole lot of things. I'll be opening for questions. Please, if you have any questions, raise up your hands and I'll give you the mic. Okay? The floor is open.
So when I firstly seated, face the camera, okay. I would love to look at eyeball, but no problem. So when I firstly look at the panelists and I saw nutrition, I said, thank God. It's high time we allowed nutritionists to be out there speaking to our people instead of just listening to the medical doctors sharing impacts only to us. So I'm actually a nutrition coach, a student of nutrition and dietetics. So, by God grace, a clinical nutritionist and a dietitian soon. When you were mentioning every of the supplements, and I remember people saying that when I'm talking to people about health, they will be like, health is only meant for, eating healthy is only meant for rich people. And then I cut them off and telling them what it truly means by eating healthy and how they can actually eat healthy without not spending too much. And I think you've showed us a lot. Even my book is filled up already. And where my question now is going to is the part of the supplements. Supplements is expensive, right? And because we know that this food we are eating, some of them are not well planted, they go through a lot of things. We want to be sure that when we buy these supplements, spending a lot of money from it, and how can we be sure of the brands we are getting it from? Number one question, how can we be sure? Number two is, a lot of people now think, okay, when I can get these nutrients from supplement, I will stop eating healthy. I'll just be drinking Pepsi and take all the likes, then I'll take supplement. How can we help people to understand that as much as you are taking your food, the supplement is also important, and stay away from junks and the likes? Then the third, I'm sorry, my question is long. You mentioned some extra herbs aside the turmeric, garlic. Like the last two, you were very rushed. I'm like, hey, I need to call you back to recap. So that's my three questions. Thank you so much. God bless you.
Okay, thank you very much for those questions. So I'll start with from the third one, because it's very simple. Get elderberry or chestberry, okay? Chestberry is very, very good. Then you can also get milk thistle. That's a herb for the liver, okay? Milk thistle. So milk is M-I-L-K. Then thistle is T-H-I-S-C-L-E. Yes, milk thistle. Okay, it's very good for the liver. Then you were talking about people. The second question is about people that eat junks and feel that they can run to supplements. I get that a lot. So a couple of weeks ago, I was talking with my friend. She's a nurse in the UK, and she was telling me, I'm going to be eating anything I like, so far as I'll get my Well Woman and I'll be drinking it. I told her, babe, if you eat anything you like and you go and get Well Woman supplements and you're taking it, you will still become my patient. You will continue to be my patient. That is it. You want to ask a question, ma? Okay, when? Okay, so I told her that you need to start from your diet. If you're eating junk and you're thinking that supplements will help you, you are wasting your time. That's the truth. You are definitely wasting your time. Look at supplementation versus the real food itself. The real food itself is the basic foundation. Before this house was built, there was a foundation, right? We're not hanging on the air. So your good food, your healthy diet is the basic foundation. So for instance, if you are diabetic and you say, I'll go and be eating anything I like, but at the end of the day, I'll go and take a glucophage, you will damage your kidney, you have diabetic retinopathy, you have all the complications of diabetes. That's the truth. So it starts from your diet. Now, how do we get to eat healthy but affordable? I will tell you the way it is. In Nigeria, we are blessed with organic food. Because if you go to the US and all those Western countries, when we travel and go to other places, we'll see that you can't even get organic. Organic food is even more expensive than the GMO foods. That's the truth. So the thing we have in Nigeria that we should even thank God for is that you can go to your backyard and you can grow your vegetables. Go to the farmer's market and get your vegetables. So it is not expensive. I don't want us to plan any diet today, but if we can even plan a fibrous diet, I can mention to you, we can break it down, breakfast, lunch, dinner with your herbal teas, and you see that it does not cost you a pocket. They are simple things. When I do prescription medical nutrition therapy for my patients, give them meal plans and all that, they'll be like, I used to think that eating healthy is very expensive, just like you said. It is not expensive. What did I mention? Ugu, this, that. Your ginger, you can still get, even though you can still get ginger of 500, yes or no? You can still get turmeric of 500, yes or no? You can still get your moringa seed, yes or no? You can still get garlic, even 200 naira, 500 naira, you can still get it, yes or no? So why can't you eat?
your rice. You don't need to go. I don't give basmati rice to my patients. I do not do that. I'll tell you, go for local rice. Go for brown rice. Yes. There are different kind of beans you can eat. So eating healthy is not expensive, please. But you see, taking medication to maintain that it is very expensive. So you can even do without the supplements. You don't have to. But make sure that even when you're taking the supplements, eating right. That's just about that. Have I answered your question? Okay, do I have another question? You want to say something?
Well, hello everyone. Well, I just want to commend my GYNAE issues for bringing in a dietitian, because you see, what you're telling everybody now, what you're telling the younger ones now, we didn't know in our own generation, and I think that is why we have a lot of health issues now and all the things we went through. And you know, I have this opportunity. I interact a lot with the younger ladies and younger generation, and you know, and I've been talking to them about all these things you've been talking about eating healthy, not eating all these things they order all the time and stuff. And one thing I also realized that yes, they might even have the knowledge, but most of them don't have the stress. I think we too went through that, because I remember that when I was having my kids, what was what I want to be, you said incorporate this into your daily life. I didn't have the time to be doing ginger and everything. What's all that? I would just make the thing as fast as, because I had too many things to do. But the thing is that after I grew up and I started having all these health complications, I realized that it is better than to have them in your daily life than to be buying drugs to what they could have easily cleared for you. So it's a good thing that they are learning that now. I was talking to, also by the way, which was when I wanted to, because of all these things I've been talking about, when I wanted to start a business, when I was talking to these children, I said, let me do these things for you. If I do it for you, then you take over from there. Let me peel your garlic for you. Let me peel this, because when you use it, especially for we women, young ladies, they won't be having all these stress hormones, all these things you're talking about. So it is good that we also talk to the younger ones and make them realize the importance of having it in their daily routine now as a prevention.
Thank you very much, ma. Thank you very much. So, on the contrary, just to add something to what you said, just to buttress, the older generation, let me not even really say the old, because mama, you're still very young. You're still young and glowing, okay? So, the older generation, like when I was growing up, what we had then was, I think when I was growing up, that was when they started introducing 2 minutes noodles. Does anybody know 2 noodles? 2 minutes noodles. That was when they started introducing 2 minutes. That was the first ever Indomie that we know. Before Indomie now started coming later. So there were a lot of things that we were used to growing up. Growing up, we did not have fast food. We did not have Glovo that you just call. We did not have chicken. Chicken Republic was not a thing. It was mainly Mr. Biggs. Mr. Biggs was like the everything. In fact, if your husband should take you to Mr. Biggs for adults, and then children on Sundays. If your dad is feeling so, happy and he's a rich man, they will take you to Mr. Biggs on Sunday, or maybe on Christmas Day. Then in our house, it's only on Christmas Day they used to fry chin-chin. But nowadays, you can get all these junks around. Everybody wants to eat junk. Nobody wants to cook anymore. Okay? So please, let's take this into consideration. And I will see many of my patients that will be saying, oh, my children, they don't like Nigerian foods. They only like Indomie, spaghetti, chicken crunchies, or whatever. Please, let's try to incorporate it for ourselves and for our children. Thank you so much. Okay, that's all. Thank you. So do we have any other questions? It's really loud. Okay.
Thank you very much. Yeah. I'm actually an agronomist. I studied agriculture in school. Basically crop production and protection. So I just want to buttress on these spices. And I'm a typical example. I had my last child through CS. And after that, a lot of things went wrong with me, So at a point in time, after that time, I noticed that I have fibroid. And even when I'm moving, it's a move and pull my clothes. And I say, okay, nice one. You know. And even sometimes when I want to sit down, it's just do like this. I say, okay, fine. I won't be able to sit. You know. So I went back to my books. First of all, I consulted with my friend who is a consultant in UCH, and he told me this. But because of what I had, I should be managing it. I said, me, I cannot manage this thing. So I went back to my book. What did I do? I had a scan. I saw it, they measured it, I collected the results. And I went to these spices. By myself, I combined them together in a bottle. And I started taking it as a tea. Hello. After 3 months, I went back to do the scan. And the, what do you call them? Synonyms? He asked me, Madam Kilelo. So I smiled. He said, this thing has turned back to pea size. And since that time, up to this present moment, I just take the tea once in a while. So what am I trying to say to everyone here today? Like, I don't have a platform where I can share this. This is my first time of sharing it. This thing on this table will take you away from the theater bed when it comes to fibroid. I did this for myself. And I've told, okay, like that man, I told him, this is what I use. And up to now, once in a while, I go and do the scan, it's like I'm free of it. So this is the best of Joe.
A round of applause for her. Okay, so there's something I forgot to add before we were almost done. All right. So another thing is I discovered in my journey fighting fibroids is that I discovered that milk, I had to switch from normal cow milk, our conventional milk, you understand, to plant milk. There was a lot of things I had to switch in my diet. That was why I was like, Lord, what's happening to me? Me of all people. It's not like maybe I'm the greatest or anything, but I'm the one that is getting women out of this. So how come I'm eating the healthiest things and this thing is still growing? You understand? So the thing is, when I discovered what was happening, I knew that, okay, fine, it's not just gynecological alone. So please and please, if you've been taking milk and you have fibroids, start cutting it down. Possibly cut it off totally. Some people ask me, what's your alternative? That was when I discovered that there are recipes for plant milk, that when you take it like this, in fact, I'll tell you for free. In fact, my journey through fibroid is what's giving me my glowing skin. Yes. Because I had to now I had to look at my body, I had to understand that, okay, there are some things that you need to cut off totally from your diet. And milk is one of those things. I don't want to delve into milk today because lactose in milk is one major thing that is affecting most of us, human beings, not to even talk of women. So please avoid milk. You can substitute with your plant milk, like your tiger nut milk. There are recipes for tiger nut milk that you'll be like, wow, tiger nut milk is very good. Coconut milk is very good. Soy milk is very good. But please, when you're taking your soy milk, watch it. It should be in moderation because there are some hormones, there are some hormone disruptors that are inside some soy that when you take it too much, it will also affect your estrogen levels. Okay? So you want to say something, ma'am?
Thank you so much. I think you touched it, that adults don't digest milk. So men and women, we should actually not take, milk. A lot of times when people take milk, you find out that you're bloated. Your stomach is bloated. Some people are lactose intolerant. You start hearing your stomach run, boo, 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 boo. Especially with people with fibroids. You hear it. I mean, you can hear that. You'll be asking somebody, did you hear that? Because you can actually hear your stomach making boo, 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 boo. And you'll be like, am I the only one hearing it? Can other people hear it? So, adults don't digest milk. So not even just for women, men as well. As adults, please stop taking milk. The one you drank from your mother is enough. Thank you very much.
So finally, just to add a little point to it before we call it a wrap. For the milk thing, there's an enzyme that's, is called lactase enzyme that is in the body of humans, okay? Now that lactase enzyme is only present in your body from 0 to 3 to 5 years old. So from 0 months old to 5 months old, to 5 years old, that is only when you have the lactase enzyme in your body. Now that lactase enzyme is what breaks down the lactose in your body. So as humans, we don't have any business with cow breasts. It's just like saying dogs should come and be drinking the breast of humans. We can't even imagine it. But the reason why science made it that we should be taking milk as humans is because among all the animals, cows are the ones that have the strongest bones. So we as humans, we are trying to borrow their milk so that it will help our young ones in their developmental stage. And after 5 years old, as a human, you shouldn't have any business with cow milk again. So it's as simple as that, because from 5 years old, that lactase enzyme begins to deplete so fast in your body. And by the time you're an adult, you don't have lactase enzyme again in your body. That is why you have lactose intolerance. It's as simple as that. So,
well, amazing. But guess what? It's not yet over. We're going to have, I like what we're doing right now, because the next thing is this. We're going to be deliberate, because we have some women, probably they don't know their status. Yes. They don't know what, if they have fibroid or not, what they need to do. So we're going to hear, you're going to come in handy. We're going to have a discussion on what can I do to detect? How can I stop it? Then you come into the bit of the nutrition, what the person can do in the early stages. Because right now we have someone that can, so we can, when we detect, we can deal with it. But first and first, how do you detect you have this, or you have symbols or symptoms of this thing called fibroid? How do you know? And what steps did you take, and what mistakes did you make, and what would you have done better? Then when we answer that question, we'll call in the doctor to tell us what could we have done. What food intervention will have worked in that aspect. So this discussion is just going to another level. Thank you very much, Ma. Put your hands
Thank
together.
you very much.
I'd like you to talk about that lactose intolerance, please. I think it's very important.
Okay.
Soya milk for a patient that have fibroid, I guess it doesn't work with them. So you were saying something about it. So I wanted to know, to what extent can the patient take, because most of them, it doesn't work for them. Thank you.
Okay, so if you notice, so let me take it in my, whenever I do diet recall for my patients, before I give you a diet therapy, what I do is I ask you some vital questions. Do you have food intolerances? Do you have food allergies? Are there food faves? Are there things? So when we look at that, you might not even know that you have a food allergy until when I start counseling you and I start asking you questions. So you will notice that maybe sometimes, that's when you now remember that sometimes if I take this soya milk, I have bloating, I have indigestion, or I start having breakouts. That is an allergy or an intolerance. Your body does not tolerate it. So in that kind of case, it's better we substitute it for you. You cut it off totally. Do you understand? That is it. And when you cut it off and you see that, okay, my body is no longer reacting this way, that is one thing. Do you understand? So the person has to watch it, because soy on its own contains some nitrates. It also contains some plants stimulating estrogen hormones too, that actually disrupt your own natural estrogens. That's why they will say some men should not take soy, because it's high in estrogen, plant-based estrogen. You know, estrogen is for women. And when a lot of men take it, it's believed that, even science backs it up, that when a lot of men take a lot of soy, it affects their testosterone levels too. That's just as simple as that. You understand? So somebody that has fibroids is already having an excess of estrogen in their body. Estrogen is already dominating among the hormones. So the person is trying to find a way to cut it down, not to increase it again. So when you're eating so much of soy, it will help to increase it. It will be stimulating it, disrupting it, and it will be multiplying the dominance. Do you understand? So that's just it. Soy milk, soy products generally. Yes. So you shouldn't take it in excess. No, if your body can tolerate it, you understand? Yes, if your body can tolerate it, but don't take it in excess. Do you understand? Don't take it. Just, even when you take orange or banana in excess, it will cause you side effects. So everything should be taken in moderation. Do you understand? That's just it. So talking a recap on the lactose intolerance thing. Let me say it again. As human beings, we are human species. We are not goats. We are not cows. Do you understand? So we don't have any business with other creatures and their milk that are supposed to feed their young ones. But because we are trying to help our own species, that's why in science we decided to bring in the milk from cow. Now, why are we bringing in the milk from cow? Because among all the animals that God created, cows, they have the strongest bone and their milk contains the highest level of calcium. And we know that in our own young ones, we need this milk for development, for our babies to have strong bones. Do you understand? Now, God that created everything knew that we need this thing. So he put an enzyme, and also with evolution too, we have an enzyme in our body called the lactase enzyme. That enzyme is only available from when you are 0 months old from the womb to when you are 5 years old as a human species. From 5 years of age, as a young child, the lactase enzyme begins to deplete. It begins to go down. So it is required that even if you are going to take milk as a human species, your body can only utilize the milk from cow from 0 months to 5 years old. And that is when your body needs to do what? To grow the bones. True or false? That is your developmental stage in life. So after that stage, you shouldn't have any business with milk again, generally. You shouldn't have any business with it. It's just like we fortifying our diet as humans. So anything from that time, once the lactase enzyme is no longer working in your body, is already depleting, that is what will make you as an average human adult to start having lactose intolerance. And what are the signs of lactose intolerance? Bloating after you've taken milk, indigestion, heartburns here and there, even acne breakouts for women, even for men too. Then it will also start disrupting your hormones. That's the truth. Okay? So that's about that. Then talking about the question that he asked me, what are the signs to detect fibroids? There are different signs. So in different women, there are different things. Now let me start from my own case. How did I know that I had fibroids? First of all, I started noticing a lot of abdominal cramps. I started noticing bloating, that I knew that what's going on. I started watching my diet, it was not still going. Okay? Then I noticed that I started bleeding in between periods. So maybe my period normally will be for 5 days. And then after that 5 days and everything, maybe in a week or 2 weeks' time, I'll start seeing bleeding again. And I'm wondering what exactly is going on. Then I had to go to the gynae to go and ask questions. Okay? Then when it started growing, I started noticing that I was having very painful periods. That's number 2. Number 3, I started noticing that I started feeling pains. Even when I'm not seeing my periods, I'm feeling pain. Then whenever I eat anything, I'll be feeling bloated. So one side of my stomach can become bloated and things like that. And I was like, what exactly is going on? So in my own case, my fibroid was not growing inside my womb, inside my uterus. No, it was growing outside. That is the subserosal kind of fibroid. Outside, more like hanging on a stalk, like a mango tree that has mangoes on it. Outside the uterus. Okay? So when it's hanging outside the uterus, you will not be experiencing excessive bleeding like most women experience. Because it's not inside the uterus, it's not inside the womb. So mine was pressing on my digestive organs. That's why I was experiencing bloating, indigestion, and those pains. Because it was outside my womb and pressing on my vital organs. Now, there are other women, most women, they experience excessive bleeding. That's what happens. That's the first sign that they know that they have a fibroid. Then they'll be having a lot of, they'll be having abdominal bulges. It will start growing and they'll be having abdominal bulges. So for people that they have the fibroid to the side, maybe outside their womb, they will have it, maybe one side will bulge out or this other side might bulge out. But people that have it in the womb, in the uterus, their abdominal parts will start, bulging. And it will start looking like maybe you're pregnant, you're 3 months pregnant, you're 6 months pregnant. In fact, I've seen people that theirs was looking as if they were carrying twins. And people thought they were like full-term pregnancy. Then you start having these excruciating back pains. Then you start becoming anemic. You'll be having this excessive fatigue. Even after a night of good sleep, I will experience so much tiredness and fatigue. Even after eating nice food and everything. Even when you take Locozed boost to boost your energy, you will still be feeling tired. So these are the things that can happen that you discover, okay, I need to check myself. Don't say it's your village people. Your village people does not have any business with your fibroids. Go to the hospital. I know what God cannot do does not exist, but you should actually take care of your health. I see a lot of women, you are already seeing a bulge, but you still be saying, what God cannot do does not exist. Be rubbing olive oil on it. It's good. I'm a Christian too. But still, wisdom is profitable in everything. So if you have other people that want to add to this, to buttress the point on symptoms to look out for, please, the floor is open. You want to say something?
Thank you so much. This is phenomenal. Thank you. Thank you. Can we give her a round of applause, please? Thank you. I think with women with fibroids, once you start noticing that, your skirts, you used to wear size 8, but all of a sudden you're beginning to wear size 10 or 12 because there's this perpetual bulge in the lower, abdomen. You know that, that's, almost a sign of, fibroids. So you need to check it. Some people have cramps. You mentioned cramps, excessive bleeding. So before you used to use 1 pack of sanitary towels or maybe 2 packs of sanitary towels. All of a sudden, it has increased to 4. And, I think it's also important for women to understand what is normal in periods. So it's very important that, we take information like this to even secondary schools, because when we talk about, fibroids, endometriosis, I remember back when I was in secondary school, there was a particular young lady who used to land in hospital every month. She'll be crying, rolling from one end of the room to the other, in a lot of pain. And she'll be saying things like, oh God, if God can just take her, if she can just die. And I'll be like, can it be so bad? And everybody just used to laugh at her that she's just, an unusual kind of person that, is it only you? They used to ask her questions like, is it only you? Is it only you? Now that I know what I know, I wish that I was able to support her at that time because that lady went through a lot. She'll be crying in excruciating pain, So when you begin to have painful periods that doesn't seem like normal, don't say, oh, my mother said to me that when we start having children, because that's what a lot of people say, oh, my grandmother said when you start having children, the pain will reduce. We need to start checking. When a child that is just under 12 says that, oh, this pain is too much when she has a period, we need to take that child to see a gynecologist so that a gynecologist can investigate and know exactly what the problem is. Once you check it on time, once you catch it on time, you can actually nip it in the bud. I think those are very, very vital things for us to check. In children, we begin to teach young children what it is to be, what is normal and what is not normal. So that when things like this begin to happen to them, nobody gaslights them. Because there's nothing as bad as you having this pain, crying, and everybody says that, is it only you? Is it not a women's thing? Everybody has periods now. Every woman has periods. Why is your own different? Don't let anybody gaslight you. If you feel pain, speak up. Say that you have pain. Go to the hospital. See a doctor. You're not, some people will say, your pain threshold is low. No. If somebody is going through pain that is making them throw up, that is making them not able to go to school, that is not making them able to go to work, then we need to check it. So those are some of the other symptoms that people need to look out for. And when you have it, don't be afraid to speak up. Don't be afraid to ask for help. Reach out to us, in my gynae if you need help. We'll be able to point you in the right direction. Thank you very much.
Amazing, amazing. Well said. My next question is going to be, how do you live with it? Probably the person has fibroid right now. How do you handle it? You have it. How do you go through that situation? She said you need a safe space. How did you overcome yours? How did you come out of that stigma to say, I need a safe space, I can trust this person? How did you come out of it? Is there anybody that wants to share experience? When you had that challenge, you discovered it. It was a shock to you. What did you do? How did you handle it?
Does somebody? Okay, will that be me? Okay. All right. There are other people here who want to share. Please feel free to share. But I think, the most important thing with, fibroids is owning up to the fact that, there's something unusual in your body that needs to be addressed. That's the number one thing. Don't just say, I wish it away. I pray that it will go away. If there's something that is not normal in your body, as a woman, we are our own best health advocates. You know your body better than anybody. You know your body better than any doctor. So if you feel something is not normal within this cavity, within this body, you need to, speak up. That's number one thing. Right. Number two is that, don't be afraid to, to ask for help. there are safe spaces. We need to begin to normalize some of these things. You know, when a woman has a period, it's normal. It's not abnormal. I remember in those days, once a woman has a period, they'll say, you can't make moi moi. Don't let my moi moi be. I remember they'll tell you, don't come near my moi moi because the moi moi will not solidify. I don't know what period has to do with moi moi. That the moi moi will not cook because somebody is on their period. So all of these myths, we need to get rid of them. I don't think, old midwives' tales. we need to grow up, and this is 21st century. There's nothing that your moi moi not being done has to do with. Maybe you put too much water and reduce the water for next time so that the moi moi can solidify. So those are the things you need to own up and find, somebody to speak up for you. If you cannot, when you go to the doctor, you also need to be able to tell the doctor exactly as it is affecting you. Tell them what it's giving me a headache, it's giving me back pain, it's giving me lower abdominal pain. Because the things that you tell your doctor is what the doctor would use to understand what's going on with you. Doctors they are human beings. They are not God. But they just use your experience. What you're telling them is what they use to diagnose the condition. Do you understand? So if there's something not right within your body, number one thing is own up. Number two thing is, you are your own best advocate, so speak up for yourself. Number three is, if you cannot speak up for yourself, find somebody who can support you. If it's your brother, we need to also be speaking to boys. From secondary schools, begin to tell boys, this is what it means to be a normal period. This is what it means to be a healthy woman. If a woman starts, crying in pain when they have cramps, when they have, periods, then, I need to know that, as a boy, I'm going to, tell my sister that, we need to go and report this to a doctor. I think those are some of the fundamental things that we need to address. And, and reach out to a community. Look for somebody who's gone through the journey. My sister here talked about her experience. Not every experience is the same. So she had a different type of fibroid, which is pedunculated. A pedunculated fibroid is the type of fibroid that hangs off a stalk. So it's like, when you have a tree, and you have branches on it, and then you have something hanging off the branch. The reason that pedunculated fibroid is painful is because sometimes it twists on itself. And when it twists on itself, in that process, maybe there's no blood supply or whatever, that pain is excruciating. A lot of people have it. If you have it in pregnancy, oh my God, it can be hell. So just, know what is normal within your body. When something is not normal, raise up your hand, ask for help. Don't be afraid to ask for help. Don't let anybody gaslight your symptoms. Don't let anyone say, is it only you? Every woman has a period. Thank you.
Ladies and gentlemen, the next woman that will give
So I'm going to talk about what happened.
Yeah, but before you start, because I know you should listen to her. Her experience is really filled with knowledge. But before she continues, if you're ready for you're a woman here, you're ready for a beauty makeover, kindly signify. I need just 4 people. You're ready for a beauty makeover. 1, 2, beauty makeover. They'll do it here. I just want to get the numbers. 1, 2. As the course of the program goes on, we will indicate, Madam, you are number 1, and Madam, you are number 2. Is there any number 3 here? Okay, let's beauty makeover. 3. All right, so 4. So we have 4 now. 1, 2, 3, 4. We won't do it at the same time. The first woman can proceed. Yeah. Others, please listen and learn from a survivor. Thank you, ma'am.
Okay, well, you asked a question about where you have, when you discover that you have fibroid, how do you handle it? So I'm going to give a practical example, and I'm not going to be talking about myself. I'm going to talk about my youngest sister. And we've just gone through 2 tragedies in the family, so I don't think any of us were in a good state of mind. And then I just got a call from my mom, and she said, your sister looks pregnant. And she was ranting and how can she be pregnant around this time? Because my sister at that time just left university. I was married in my own home. And she's not talking, she's not doing anything. I remember my mommy shouting and telling me, I don't want to wahala again. No. I just buried 2 people and she shouldn't abort it if she's pregnant. So I called in my sister to come in and then let's have a discussion. So when I looked at her, she did look like that. So I said, what's going on with you? And I said, are you pregnant? If you're pregnant, there's a way you talk to the younger, like, if you're pregnant, don't worry. Let's just see what we can do. And then she said, she's not. And that I could see she was so upset and everything, and she started crying, and she said, when I asked for her to come over, she went over and did a scan because she knew there was something wrong. We had to. And she was like, it's only if there's immaculate conception that she can be pregnant. But actually her stomach was getting bigger. So she said she went for a scan and they said, you have fibroid. And she didn't really have much knowledge. So when I came with, I said, well, actually I don't really have much knowledge about that too, even though at that time I think I had like all my kids. So I said, but luckily for us, there was a neighbor that was a medical doctor that was my friend. So I said, let's go there. Let's just go have a discussion. And the man looked at her and said, how old are you? And she said she was 24. He said, well, do you have a boyfriend? She said she has someone that she wants. He said, you have fibroid. I will have, and we could remove it because it's actually growing big. Looked like they told her it was like a 7-month-old pregnancy. And 7-month-old baby, not pregnancy, baby, yes. And the doctor said, if you know you are sure of the person you are marrying, and he's going to marry you soon, I will remove it for you tomorrow. But if not, go. When you people are ready, because something about these things, actually I don't know what, maybe that's what she had, the type she had, they tend to grow back. Then that's when he gave us all the theories about when a woman gets to a particular age and your body knows that it is time to start reproducing. And if it's not reproducing anything, it will create something for itself to take care of. And so our own body, because she was getting to that age and there was nothing for the womb to carry, so the womb produced something for itself to carry. So he said, go get ready to carry something so that when I remove, then you can replace with a child. So she went back, and like 6 months or 7 months later, she said, okay, my man has proposed. So we went back to the doctor and we removed. Like a month after our marriage, she was pregnant. And that was how this issue of the fibroids was solved. But I was happy because she was totally ignorant. We had someone that we could talk to that could give us, because I imagine if we had removed it immediately at that point, probably would have removed again before she got married or something, or after, because probably it would have grown back. So that is what I'm saying. If there's an issue, please talk to someone that is knowledgeable. Don't try to do something on your own.
All right. Doctor. All right.
Thank you very much, Mama, for that. We get this a lot. And I'm going to also share from my own experience too. So most times they tell young ladies, if you know you have fibroid, the first thing they'll ask you. I remember the first time I was diagnosed, the sonographer was like, dietitian, and this one that you have fibroid. First of all, before you told me I have fibroid, before he even mentioned it to me, he first of all looked at me. Do you have a serious relationship? I was like, what does serious relationship have to do with scan again? Oga, tell me what's going on. He said, because the way it's going, you need to get pregnant very fast. I was like, I don't understand. Is it Angel Gabriel that will give me the pregnancy? What is going on? So he told me, you have fibroids. I said, okay, so what does that have to do with anything, with man and whatever? He now told me, because this fibroid, if you don't get pregnant fast, this one will happen, that won't happen. So there's a saying in medicine that if your body has gotten to the peak of reproduction, okay, and you don't start making babies, your body will start making babies. It's a saying, it's like a slang in medicine, it's a popular saying in medicine, that if you don't start making babies with your body as a woman, when you're supposed to make babies, your body will automatically start making babies. And the babies your body will start making is fibroids. You understand? Now, this now puts a lot of women under a lot of pressure. Because I remember when the fibroid thing now started getting really bad, and that was part of what caused me the trauma. I believe this is a safe space for us as women. That was part of what caused me the trauma, because the person I was seeing as at that point was now using that fibroid to gaslight me, to make me settle for less because I had fibroids. So a lot of women go through these things, and we end up being in the wrong hands because of these things. But I told myself, no. Yes. So, in fact, when the whole thing started, that was how the fibroid that was just 3 cm went from 3 cm to about 18 cm. Yes. Because I was now trying to bend in to fit into a space where I don't belong, because I was being gaslighted because of the fibroids. So these are the things we need to understand. That's why when I started this talk, I said fibroid is not just gynecological. It's not just about your uterus. It's about the body that is carrying it. So fibroid is emotional, it's psychological. It has to do with balance. Because I've had this fibroid for 2 years and it wasn't disturbing me. It was just that 2 cm and it wasn't going beyond that. Then all of a sudden, it now started growing because I was in a toxic environment. So the anxiety, the PTSD, everything was making it grow. Then when the gaslighting started, it now had exponential growth. So please, nobody should gaslight you into staying where you don't belong, because that's what will make that fibroid to grow back. If you're in a toxic environment, it will make the fibroid to come back. Even if you get pregnant today, you can still get pregnant, and then after your baby, you will still have another fibroid, and it will be worse, because I've had patients like that. And having patients like that, then I didn't understand until I experienced it myself. So please, as women, we should understand that our womb is our power. And if your womb is contaminated, when I say contaminated, it's not contaminated by food or dirt or germs. If it's contaminated by the wrong energy, it will show in your body. Okay, so that's my point. Thank you very much.
Wow, amazing. I have another question for us, because now how do we create that safe space? We know that, okay, you've discovered, who do I run to? Who do I talk to? Who do I share? It's like a stigma in the society. In fact, if you tell your in-laws, they're like, really? Now we found out that we need to get to a safe space where there's positive energy. How do we create that positive energy? And how do we reach out to help? And what can we do in the society to mitigate against it?
Okay, so I'm going to answer this other question again. Safe space. The beautiful thing about women is that we have community. And one beautiful thing about healthy women communities is like a sisterhood. Yes. If you find yourself a healthy, I don't mean community where they do competition, Kim K vibes, Instagram babes, body, fake it till you make it. That's not a healthy community. Or snatching people husband community. No. I mean healthy, you're laughing. I mean healthy female communities are like a sisterhood. Sisterhood that holds you accountable. Sisterhood that is there for you. And I happen to find one, and I'm a beneficiary of one. That is why I'm here today through Sister Oyinko and Sister Bola. That is the GYNAE Foundation. So if you happen to be here and you're a woman and you've not joined my GYNAE Foundation, you've not joined this sisterhood, then you're not doing yourself any good. So please find you a healthy sisterhood, a healthy community of women to join. Women that will understand, women that will not gatekeep good things from you. You understand? Because there are communities you will join and they will know these things, they'll have this knowledge and they will gatekeep it. We don't gatekeep in our community. We are out to save you. That is the truth, and that is what sisterhood is all about. So please, find somebody, find communities that you can go online, find them, even on Facebook. There are different ones. Okay, find them. Don't only be attracted to communities where they are checking the latest bone straight or the latest Instagram body. No. Go for healthy female communities. That is where to start from. Then aside from that, you can also go to your nearest health center and talk about it. A lot of women who have been silenced, who have been made to believe that, okay, once you're a woman and you're going through anything, try to, hold it in. Try to hold it in. Save yourself. Nobody's coming to save you. No, it's not true. There are people out there that are coming to save you. It must not be a knight in a shining armor. It can be the mama, the midwife, the matron, the nurse, your church member. Talk to somebody. And don't think about it that I've gotten to a point in my life where, before I used to think, oh, if I tell this guy that I have fibroid now, he will run away. He'll start looking at me like I'm barren or something. It's a saying. Yes, it's common. If you've ever heard it before, please raise up your hands. When they'll say, oh, she has fibroid, are you sure she can give birth? Are you sure she can take in? Those things are silly stigmas. Forgive my use of words. Yes. They will look at you, they will feel that you're infertile or something. No. I've come to that stage in my life where I don't care whatever you want to say because of your ignorance. You don't know it. It's your ignorance. Your ignorance shouldn't be my problem. So if I tell you I have fibroids and then you feel that because you don't know about it and you don't even want to know about it, you don't want to be enlightened or educated and you run away. Beautiful. That's your loss. That's my gain. That's the truth. Because I just lost an ignorant person that doesn't want to learn. So please don't allow anybody to gaslight you or stigmatize you into now being in your shell and you will not want to talk to someone because you'll be like, if I go and talk to this mama in my church now, she'll just go and put it in CNN worldwide. Let her go and put it in CNN worldwide, but get your solution. That is the truth. If you don't speak up, you will not be saved. And many women will be silenced for so long. So please, I'm encouraging and impacting every woman out there. Speak up. Because it's when you speak up, you will get solution. Thank you very much.
Amazing, amazing. Speak up to get solutions, and we're speaking up here. One more question for ask. Now, this go to the founder. How can we advocate women's health? How can we push that frontier? You've been in for a long period of time. You've seen several things. How can we do it right? How can this nation get it right concerning women's health? Advocating for it.
That's a very big question. Thank you so much. So women's health is very important. And, we notice that it's actually not getting the right kind of attention. I don't like to say this a lot because, I'm not that, Miss Feminist that people talk about. But it's important to know that, I hear people say that, if this was something that affects men, if fibroids was something that affects men, that, maybe we would have found a solution to it. Well, maybe to a certain extent that may be true, right? But, how can we push this further? A lot of research is required. Do you understand? Research is one thing that will make us understand. Everybody's come. Nutritionist Daisy has told us, all sorts. So in that nutritional space, we see how the food that we eat, affects our, body and all of that. We see that, doctors tell us that, because we're predisposed naturally because we're black people. Some people say, it's because, if your mother had it. Of course, my mother had fibroids, so, because I had fibroids, automatically I just, I take it that, okay, because my mother had it, I definitely would have it. It may or may not be true, but how do we find out if it is the exact thing? It is by doing research. Do you understand? So if fibroids and other ailments that affect women can be given enough attention, can be people who advocate for health, they focus on it. They go and do research to understand what exactly is the root cause of these fibroids. What can we do, right? So that it is definite. We know that this is the definitive cause. I think that's the first thing that we need to find out. If we find out the root cause, then nobody wants fibroids. So who wants to? I've had 3 surgeries because of fibroids. Do you understand? In fact, 4 major surgeries to deal with fibroids. So people don't want to go through all of that. I mean, I'm here, I do the work that I do so that other people don't have to have the number of surgeries that I've had. But I'm saying to you that fibroid cost me that much stress for me to have so many surgeries. So I think number one thing is advocacy, by speaking up, by making sure that, this is getting the right kind of attention, that everybody that needs to support women are supporting women. And also by taking this education beyond, just, a small gathering. It is taking it into, secondary schools. Let children learn from a young age. Learn from an early age what is normal. Let us understand what is normal and what is not normal. I think those are the first things that we need to do. I will let Mrs. Daramola, buttress that point, but I think those are the first, important things that we need to do. Research more, speak up for yourself, advocate for yourself. You know your body better than anybody else. So if something is not feeling right, be quick to raise up your hands and speak up. Find somebody that has gone through the experience before. Because when you have that kind of person, when they help you, it means that, the problem that you have is half solved. Anytime I speak to women, it's always incredible because it feels like 80% of the problem is gone. And 80% of the problem is actually the fear factor. Once you take out fear, then they are ready to explore the options. But it's the fear factor that holds people back. I don't want to die. I remember the first time I heard about fibroids, the first person that I know that had fibroids, she actually didn't make it, she died. So from that time, anytime, I hear about fibroids, I'll be like, oh God, that woman that died. But no, it doesn't have to end in death. If you go to the right doctor, I always say that, a few things that women need to do, everybody needs to choose their doctor with prayers and with a lot of sense, common sense. You need to understand that not every doctor is your doctor. Now, doctors are knowledgeable, but doctors sometimes also want to prescribe the solution that is easiest for them. You don't understand? Because the ratio of doctor to patients is like, I don't know, the disparity is so huge. So they cannot speak to everybody, give you 30 minutes because they don't have 30 minutes. There are 1,000 patients waiting to see the one doctor. Do you understand? So when you go and speak to a doctor, you have to have prepared all your questions so that, as you're asking, they're addressing it. As you're asking, they're addressing it. Doctors also, may not really pay attention to you if you're not speaking up for yourself because they can only talk to you if you even understand what is wrong with you and if you can explain to them. So if you can't explain what's going on in your body to a doctor, the doctor cannot use X-ray to see your body, physical eyes. Do you understand? So he can only prescribe and diagnose based on what you're telling him. Do you understand? So I'll cut it short. I'll just leave it there. Thank you very much.
Well, I want to actually talk about some of the things she spoke about. And I was going to say that I've listened to a lot of things here today. I've learned a lot. But I keep waiting for that thing that is basic for us women. And yes, people have been touching it around. And we've not really addressed it. And that's the basic. And that is we as women should love ourselves first. I'm a woman, I'm a mother, and I'm a wife. But you see, when we want to put the hierarchy, you put God, then you put maybe your children or your husband, it depends on how the level of importance is. Then probably you put your business. And then maybe you put your church, and then you put maybe your friends. You are usually at the last rung of the ladder. You'll have settled everybody before you remember yours. Maybe that's how I was. And that was how I lived my life. So why won't you have stressors? Why won't you have fibroid? Why won't you, when you don't even have time for yourself? When you don't want to, let me give you a very funny, a practical example that till today is still, I don't know, it gives me a headache. I don't understand. I started a business. It's food. It's designed to reduce stress for women in the kitchen. We've done these things for you halfway. So when you enter your kitchen, you don't spend more than 10, 15 minutes. And I was so sure when I was planning it and I was talking to people, I was like, all the wives and the mothers, this is for them. It's the solution to the problem. They won't be spending so much time. After like 6 months into the business, I found out that they were not my customers. They liked the stress. They loved the stress. In fact, they were feeling guilty. My customers were the younger ones, from 23 downwards. Those ones, they don't care. Once I told them, you won't peel ginger, you won't put garlic, all these things are healthy things. I've done it for you. I've made the stew for you halfway. I've made your love mix for you halfway. I've done this for you halfway. You just enter your something, do this, do this. They were even asking me, give us instruction, how we'll do it. You are out of the kitchen. They don't care, they take it. But the mothers and the wives, they will take once and put it in their freezer for the day they are exceedingly tired and their husband is asking for food at 3 a.m. That's when they remember. So it's only for once in a blue moon. And in fact, me as a smart business person, of course, I changed my marketing tool and dealt with people that had the sense. But each day I think about it. You will go to work with the men, you come back. He will sit down and watch TV and football. You will enter the kitchen. One child is pulling your leg, another one is telling you, the one is calling you and saying, why have I been calling you for the past 5 hours and you're not picking my calls? And another person is calling you just to say, Mommy, I just wanted to say good morning. They don't care about the fact that you are tired and you two have just been working like them all day. They all expect you to attend to them first. And you are still cooking and everything. And I've brought you something that will make you easy and then you feel guilty. Why? And I think that is why I said it's because we don't have self-love for ourselves. And that is why we have all these diseases. We should start thinking proactively. These days, you see, when I thank God for my GYNAE issues, thank God for Oyinkan. I remember the day she forced me to the hospital. I was telling her that I can't go that day, I will go tomorrow. Because my husband gave me some instructions. And I had to do it first, finish that first. So I said, please, let me just go tomorrow. And she's like, your blood count is 5. And you are saying you want to go and be looking for something. You can die now. And I kept on saying nothing will happen to me. They actually dragged me into the car, dragged me to the hospital. I was still telling them in the hospital, no, I'm not going to sleep here. Oh. I have things to do. But when I saw death, and I saw the same people that I was trying to satisfy. Oh, they showed, Mommy will love you, but nobody was sleeping in the hospital room with me. That's when I started choosing myself first. Because if you die today, everybody will continue living. Those children will mourn you. After 6 months, life goes on. The husband will mourn you. And in the next few months, they will say it's not good for a man to be alone. And so the person will marry. And that will be the end of that person's story. And that was when I started choosing life. So now I put God first. Then I put myself second. Then I put my children. Then once in a while, my husband, my business, my husband, my business is moving like that. I can't kill myself. And that is it. So I'm telling you today, all these health things, the basic thing you should have first for yourself is love yourself first. Don't put yourself the last on the ladder. Don't. Because I was telling someone one time, I said, it took me, I think the last time I had good sleep was when, just before I married. Ever since I married and started having, I don't think I've slept 5 hours straight. Even in that sleep, you're already thinking of the food that your husband will eat. You are thinking of so many things. So even the sleep self, you are not sleeping it well. Why won't you have stressors? Why? Because we can't even remove our mind off it. Even till now, that even all the children have got everything. My children are in Canada. They don't even care. I told one of them, I said, you must be very funny. Because you know this is 3 a.m. Nigerian time. And you are calling me just to tell me that somebody in the bus looked at you somehow. What is my business with that? And these days, I've started becoming more like selfish. Please be selfish a bit. Be selfish a bit. Love yourself. Because if we die today, somebody else will replace us.
Thank you all so much. Thank you. I think the last thing, thank you very much. Thank you all so much for staying till the end. I think the last thing that I'll just quickly touch on, nutritionist Daisy mentioned it. It is, taking away shame and stigma. We need to be able to, know that there's nothing to be ashamed of. Fibroids is not happening to you because of what you did. So don't be afraid to talk about it. We need to begin to normalize things. Don't let, again, I am repeating it, don't let anyone gaslight you. Because you have fibroids, they should not tell you that, you can't have children. I know plenty of people that had fibroids that have healthy children. I know a lot of people that their fibroids was growing and their baby was growing, and they were able to, carry both together. Do you understand? So please, enough of, shaming. Enough of the stigma. Thank you very much. I want to say thank you to, Rotary, District 9112, and to you all for making this a huge success. Thank you.
Good afternoon once again. I will close this section before I call on my club president to give us a vote of thanks. I would like to say this, and I'll say it in vernacular. With all that we've said today, first of all, let he that have ears, let them hear. That's one. Number two, my grandmother used to say that anybody that say they should not laugh at her or him, they will cry the person. So with these few points we've heard, we have the option of choosing what we want for ourselves, whether as a man, whether as a woman, whether as a child. It's your responsibility to choose what you want for yourself. And please, I want to appeal to us that this program was organized by my GYNAE Foundation in collaboration with Rotary District 9112, Rotary District 9112, and the Rotary Club of Ajah Golden. So it's a joint project, and we're so excited to have everyone present here today for this event. In fact, let me give you an hint now. Somebody's already begging that the video of this program, she was here, and she said, I don't know why Rotarians did not come out. So I want them to please post it on Women in Rotary Bath, and I told them they will pay for it. I said they were going to pay for it because knowledge is not cheap. So when we decide to give you free knowledge, grab it with all effort. And I want to say thank you to everyone that has stayed to the end. And on this note, I'd like to call on my club president. I'm always proud to call him my club president. He has been here since the very beginning of this program to just give us a short vote of thanks while we call it a day. I will not fail before my president can come, Botidemi Duncan. Please come forward. And please, I want to say thank you to Rotaractor Atitebi, the district Rotary representative, for staying all through. Thank you very much.
Good afternoon, everyone. Good afternoon, everyone. I hope we enjoyed the various sessions that we had today. I know that we had a few men that were here. Primarily, people thought it was for women. But I always say, as far as gynae issues are concerned, the women cannot do it alone. The women need supportive men. The men could be brothers. The men could be husbands. The men could be friends. But they need men because we are all in it together. Fibroid can be quite challenging, but I also know that with the right care and especially if you notice it early enough, it's something you can resolve. So it's just for us to take care of ourselves, like everyone has said, get the right medical support. Even when you are pregnant, I know that my wife had fibroid when she was pregnant, and because we had the right care, some other people could have been worried, but we were never worried because we knew we had the right care and we had to see the doctor every 2 weeks. And with that, she carried till time or full time. So let's do what we can do and make sure that we are fine. I want to thank Rotarian Onyekon, our very own Rotarian Onyekon. Thank our foundation as well. Thank the district. The district governor, Rotarian Lanre, has been very, very supportive with the right leadership. And then the Rotaractors around as well. You know, Rotary without your energy is almost zero. A lot of us discovered Rotary in the university. So, you know, we cannot do Rotary without Rotaractors. So thank you for all you do. And to everyone that came, please, thank you. This event is we always have it often enough. So whenever there is another program by my GYNAE issues, please find time to come around. And I wish everyone a wonderful and safe journey back home. Thank you. As Rotarians, we'll just take the Rotary grace. We'll rise as we take the Rotary grace. O God and giver of all good, we thank thee for our daily food. May Rotary friends and Rotary ways help us to serve thee all our days. Thank you very much, everyone.
Once again, we'll say thank you to everyone. We want to appreciate all our invited speakers. From Professor Gynaecological to Raman, Dr. Daisy, and to all the participants online and on site. We do appreciate you for staying till the end of this program. I also want to thank the Rotarians around. Thank you for making this event successful. Till we meet next time, you can follow us at My GYNAE Foundation. You can check us on Instagram to follow us for more details. Thank you very much and have a lovely day. If you were still part of the beauty makeover,